Two patients flatlined at the exact same second. Not similar seconds, the same second. The trauma bay erupted. Alarms screaming, nurses spinning in three directions at once, veteran physicians frozen at the foot of two gurneys with their hands out like they'd forgotten what hands were for. Then a travel nurse nobody remembered hiring stepped between the beds. No panic, no hesitation. She moved like someone who had done this in the dark, in the rain, with bullets in the air. 12 minutes later, both patients had pulses. Outside, black SUVs were already pulling into the parking lot of Riverside Crest Medical Center, and a Navy Vice Admiral was walking through the front doors asking for someone named Phoenix. If this story already has you on the edge of your seat, stay with me until the very end. Hit that subscribe button, leave a like, and drop a comment telling me what city or country you're watching from. I want to see exactly how far this story has traveled. PA Evelyn Cross arrived in Silver Ridge, Colorado on a Tuesday that smelled like coming snow. She drove a 12-year-old pickup truck with a cracked passenger side mirror and a coffee cup wedged between the seats that had been there long enough to qualify as a permanent fixture. The truck needed an oil change. The heater worked intermittently. She had one duffel bag in the bed and a folder of paperwork on the passenger seat that said she was a licensed travel nurse with 18 months of civilian experience and references from two hospitals she'd worked at in the past year, one in Eastern Oregon, one in rural New Mexico. The paperwork was accurate. It was also the smallest possible version of the truth. She pulled into the Riverside Crest Medical Center employee lot at 6:43 a.m., 17 minutes before her orientation was scheduled to begin. Sat in the truck for a minute. Watched the building. It was a regional trauma center, 6 floors, about 300 beds, a level 2 trauma designation that the administration was trying to upgrade to level 1 before their next accreditation review. That detail was in the publicly available documents she'd read the night before at a motel outside of Pueblo. Old habit. Read the terrain before you enter it. She grabbed her duffel, locked the truck out of something close to habit. Silver Ridge was a safe enough town that most people didn't bother, and walked through the employee entrance at 6:46. The woman at the orientation desk gave her a badge and a packet and pointed toward a conference room without making eye contact. "Orientation's in there. You're the last one." "I'm early," Evelyn said. "Dr. Crow likes people to be very early." Evelyn filed that away and went into the room. There were 4 other new staff members seated around a long table. 2 RNs, a surgical tech, and a respiratory therapist who looked like he was still finishing his coffee. Evelyn took a chair near the end of the table. She set her duffel under her seat, folded her hands, and waited. Dr. Nathan Crow came in at exactly 7 o'clock. He was the kind of man who considered punctuality a personality trait. Early 50s, square-shouldered, silver-haired in the careful way of someone who thought silver hair made him look distinguished rather than just older. Chief of surgery at Riverside Crest for 11 years. His introduction made sure everyone in the room knew that within the first 3 sentences. He walked the length of the table, glancing at each of them in turn like he was assessing produce at a market. When he reached Evelyn, he paused. "Travel nurse," he said. It wasn't a question. He'd clearly already read the files. "Yes, sir." "From?" He glanced at the folder his assistant had handed him. "Most recently, Grants, New Mexico. Community hospital." He made a sound that wasn't quite dismissive and wasn't quite anything else. A sound that established, cleanly and economically, that he was not particularly interested in community hospital nurses. "We're a level 2 trauma center. The pace here is different from what you're used to." "Understood." He looked at her for another second, as if waiting for her to add something, a credential, an anecdote, something that would make her worth a longer look. She didn't give him one. He moved on. The orientation lasted 90 minutes. Crow spent 40 of them discussing his personal surgical record and the department's performance metrics under his leadership. The remaining 50 covered actual hospital protocols. Evelyn took notes on everything. On the protocols, not on Crow. She was assigned to the trauma and emergency unit under the floor charge nurse, a woman named Marisol Vega, who was efficient, fair, and chronically understaffed. Marisol gave her a 12-second tour of the supply room, a 30-second overview of the EMR system Riverside Crest used, and then said, "Bay 4 needs a line drawn. Can you do that without me watching?" "Yes." "Then do it." Evelyn did it. She also restocked the crash cart in Bay 2 without being asked. Because it was low, and someone should have caught that during the morning check. Marisol noticed. She didn't say anything, but she noticed. The first 2 weeks were like that. Evelyn did her job. She showed up on time, sometimes early. She made no errors on documentation. She assisted in 3 minor trauma cases and handled them without incident. She was quiet in the break room, ate lunch at irregular hours, and didn't volunteer much about herself when the other nurses asked the usual getting-to-know-you questions. Where are you from originally? Various places. Married? No. What made you go into nursing? I like being useful. Technically all true, all spectacularly incomplete. The other nurses mostly left her alone after that, not out of hostility, just out of the reading that some people were sociable and some people weren't, and this one clearly wasn't, and that was fine. Dr. Crow, for his part, seemed to assign her the cases he considered least urgent or most tedious. Wound irrigation, IV management for post-surgical patients, discharge paperwork for the beds that needed to cycle through. She did it all without complaint, which seemed to mildly irritate him, as if he'd been expecting her to buckle or push back, and her simple compliance denied him whatever response he'd been building toward. On her third Thursday, he stopped her in the hallway outside the trauma bay. Mrs. Cross. Ms., she said. He didn't adjust. I've been looking at your patient throughput. Your charting is adequate, but I've noticed you have a tendency to spend more time with patients than the floor schedule allows. We run a tight operation here. I understand. The patient in room 14 was showing early signs of compartment syndrome that hadn't been flagged yet. I wanted to make sure the note was in the chart before the attending came in. A pause. Compartment syndrome. Left lower leg. Consistent with the mechanism of injury and the soft tissue presentation. I noted it and flagged the attending at shift change. He looked at her. A long look this time. Not the dismissive scan from orientation. Something more careful. You diagnosed compartment syndrome. I documented an observation and flagged it for physician review. Dr. Alvarez confirmed it and ordered the fasciotomy this morning. Patient is recovering. She held his gaze. Easy, level. He said nothing else and walked away. She turned back toward the supply room and continued what she'd been doing before he stopped her. Behind her, she heard him say something to his assistant that she couldn't quite make out. The word overstepping may have been involved. She didn't look back. The shift that changed everything started. Like most shifts at Riverside Crest started, understaffed and behind before anyone had clocked in. It was a Friday, early in her 4th week. Marisol had called in 2 nurses short by 6 a.m. A surgical resident named Dr. Patel was supposed to be covering trauma consults, but was stuck in an appendectomy that had hit unexpected complications. The ER attending, Dr. Roderick Haynes, was a capable physician on most days, but had the specific bad luck of having been called in at midnight the night before and hadn't slept in 21 hours by the time the day shift started. Evelyn clocked in, read the board, and began her rounds. The first hour was manageable. 2 post-MVA patients in observation, 1 elderly patient with a hip fracture, waiting for an orthopedic consult, a 40-year-old with chest pain whose EKG looked clean, but whose history was making Haynes nervous. Evelyn did her assessments, updated her charts, assisted a phlebotomy that the lab tech had fumbled twice on a difficult vein. At 8:17, the radio crackled at the nurse's station. Marisol was on the phone with pharmacy and held up one finger. Give me a minute. Evelyn was closer. She picked it up. The paramedic's voice was tight in the way that trained people get tight when they're managing something bad, and keeping the panic compressed down into the base of the voice where it doesn't interfere with function. Riverside Crest, this is Unit 7, we're inbound with 2 critical. Highway 24, single vehicle rollover, driver and passenger. Driver is a 43-year-old male, GCS 8, suspected intracranial bleed. BP is tanking. We've got a line in, but he's not holding. Passenger is a 19-year-old female, chest trauma, breath sounds unequal, possible tension, pneumo. ETA, Evelyn said, 4 minutes. We'll be ready. What's your IV access on the male? Single large bore, left AC. Get a second line if you can. Right EJ if you have to. Keep him at 30 degrees and push the fluids carefully. If it's an intracranial bleed, you don't want to overcorrect the pressure. A brief pause on the other end. Paramedics didn't usually get clinical pushback from the radio. Copy that. She set the radio down and turned to the board. Marisol was off the phone watching her. 2 inbound, Evelyn said. 4 minutes. Probable intracranial bleed and suspected tension pneumo. Bay 1 and 2. We need Dr. Haynes, and we need a respiratory tech now, not in 5 minutes. Marisol moved. That was what you did with someone who spoke in that particular register. You moved. The next 4 minutes were controlled chaos in the way that good trauma teams produce controlled chaos. People moving fast, things getting set up, no wasted motion, no one asking questions that didn't need to be asked. Haynes came through looking like he was running on vapors, but capable. The respiratory tech, a man named Oscar, materialized from somewhere down the hall. The ambulance bay doors opened. Both gurneys came in simultaneously. The paramedic crews had clearly coordinated outside. The male patient, mid-40s, big man, was deteriorating visibly. His pressure was 78/40 and dropping. His pupils were unequal. The female patient, young, athletic-looking, was conscious but gray around the mouth, working too hard to pull each breath, the left side of her chest barely moving. Haynes took the male. Evelyn was already at the female patient's bedside, running her hands along the chest wall. "What's your pain level?" she asked. "Can't." The girl couldn't finish the sentence. "That's okay. Don't try." Her fingers found the third intercostal space, left side. Deviated trachea. Absent breath sounds. Jugular veins starting to distend. "Dr. Haynes." Haynes looked up from his patient, who had just begun to seize. "This one's a tension pneumo. She needs needle decompression right now." He was 40 feet away with a seizing patient and no hands to spare. "Get Patel." "Patel's still in the OR. She doesn't have time." Evelyn was already reaching for the supplies. "I need you to verbally authorize. Cross, that's a physician procedure." "Dr. Haynes." Her voice didn't rise. It didn't need to. It just became extremely clear. "She has 30 seconds, maybe less. Authorize it or come do it yourself right now." He looked at his patient. He looked at the girl. He looked at Evelyn's hands, which were already prepped, already positioned, already knowing exactly where to go. "Do it," he said. The needle went in. The hiss of released air pressure was immediate. The girl's oxygen saturation, which had been crashing toward 70, began climbing back toward normal on the monitor. She pulled her first full breath in minutes, and it sounded like something released that had been held under enormous pressure. Evelyn was already converting to a chest tube. Across the bay, Haynes's patient flatlined. Then the second monitor, the girl's, flatlined too. For one terrible second, every alarm in the trauma bay was screaming at once, and Evelyn was aware of several things simultaneously. Haynes shouting for a crash cart, a nurse backing into a supply tray and sending instruments clattering, the respiratory tech staring at the ceiling tile like he'd forgotten where he was. Evelyn had seen this before. Not here. Not in any civilian hospital. Somewhere much louder and much darker and much further away than Silver Ridge, Colorado. She moved to the girl's bedside. The arrhythmia on the monitor was V-fib, probably a contusion to the cardiac tissue from the chest trauma, now expressing itself with the release of the tension pressure. She grabbed the defibrillator, charged it, looked at Oscar. "Clear." He cleared. She cardioverted. The girl's heart came back in sinus rhythm on the first shock. Oxygen saturation continued climbing. She turned. Haynes was doing CPR on the male patient. Good compressions, correct rate. She stepped up beside him. The intracranial bleed complicated everything. Normal resuscitation pressures could worsen brain hemorrhage, but they were past the point of managing it elegantly. She checked the IV lines, saw the access issues, found a second vein on the right neck, established access, drew blood for a type and cross, handed the syringe to the closest nurse without looking at who it was. "Get neurosurgery on the phone now," she said, "and I need a second attending in here, now." Haynes kept doing CPR. "You a doctor?" he said between counts. "No." "Then what the hell? Keep pushing." She adjusted the vasopressor drip that had been running. "His pressure needs to be here, not here. If you correct it too far, you're going to blow out the bleed." The male patient's heart came back 4 minutes later. Unequal pupils remained. There was likely the significant intracranial damage. But he had a pulse. He had a blood pressure. He had a chance, which 30 seconds ago he hadn't. Neurosurgery arrived at a run. Evelyn stepped back. She found a wall and stood next to it. Her hands were completely steady. Her breathing was even. She was aware of a fine layer of sweat on her forehead that she hadn't noticed until just now. Marisol was at her elbow. The charge nurse was looking at her with an expression that Evelyn had seen before too, the expression of someone recalibrating a calculation they thought they'd already finished. You certified for chest tubes? Yes. Defibrillation? Yes. That pressure management on the TBI patient, traumatic brain injury management, you maintain cerebral perfusion pressure in a specific range. Too low and you lose brain tissue from ischemia. Too high with an active bleed and you... She stopped. It's covered in the advanced trauma certification curriculum. Marisol said nothing for a moment. Then, go chart it while it's fresh. Evelyn went and charted it. She was halfway through her documentation when Dr. Crow appeared in the doorway of the charting room. He stood there long enough that she looked up from the keyboard. I heard there was a situation, he said. 2 critical traumas. Both patients stabilized. Dr. Haynes is the attending of record. He'll have the full narrative in the chart. Crow stepped into the room. He wasn't looking at her with the same half-dismissive assessment as before. He was looking at her like he was trying to solve a problem, and the pieces weren't behaving the way the pieces were supposed to behave. They're saying you ran those bays. Dr. Haynes ran both bays, I assisted. They're saying... He stopped, started again. A chest tube. That's not a nursing procedure. Dr. Haynes authorized it verbally under emergency exception. It's documented. And the TBI pressure management. Clinical recommendation to the attending, also documented. You're a travel nurse from a community hospital in New Mexico. She met his eyes. I'm a travel nurse currently assigned to your trauma floor. Is there something you need from me for the incident report? The silence stretched in the particular way silence is stretched when someone wanted to say something and was deciding whether the thing they wanted to say would cost them more than it was worth. He left without saying it. The rest of the shift moved in the way shifts moved after a major event. The adrenaline had passed, the paperwork was accumulating, and everyone was operating slightly slower than normal and pretending they weren't. Evelyn finished her charting, completed her remaining patient rounds, assisted with a dressing change on a surgical patient in 8B who'd been difficult with the other nurses and was inexplicably cooperative with her, and clocked out at 7:06 p.m. She was in the parking lot, 12 steps from her truck, when her phone buzzed. Not the personal cell. The other one. The one that lived in the inside pocket of her jacket and had a number known to approximately 4 people on Earth, none of whom she'd heard from in 14 months. She stopped walking, looked at the screen. The message was 3 words and a set of coordinates. Active. Come now. She stood in the parking lot of Riverside Crest Medical Center in the dark, with the Rocky Mountain cold coming down off the peaks, and the lights of Silver Ridge spread out below the hospital hill, and she read those 3 words twice. Then she put the phone away, unlocked her truck, and drove to the motel. She had a bag she could pack in under 4 minutes. She'd packed it under 2 when circumstances required. She sat on the edge of the motel bed, and she thought about the 2 patients she'd stabilized today, and the chart notes she'd left, and the fact that neither of them were likely to know who it was that had made the decisions that kept them alive. Then she opened her laptop and ran a search on the coordinates. A location in western Montana. Remote. The kind of terrain you chose when you didn't want to be found, or when you were keeping something, or someone, that you didn't want found. She stared at the screen for a long time. Outside, she heard a vehicle pull slowly through the motel parking lot. She didn't look up from the screen, but she tracked the sound, the speed, the pattern of the engine, the specific absence of a second pass. Not surveillance, just a late-night arrival at the motel. She exhaled, reached under the bed and pulled out the second duffel, the one that wasn't packed with nursing scrubs and certification folders. The one she hadn't opened in 6 months and had been hoping, in the particular quiet and cautious way she'd been hoping for a while now, that she wouldn't need to open again. She set it on the bed next to her. Didn't open it yet. Just put her hand on it. The coordinates in Montana. The 3-word message. The number that only 4 people knew. 14 months of silence. Then this. She closed her laptop, turned off the room light, sat in the dark for a while, in the particular way she'd learned to sit when she needed to be very honest with herself about what she was going to do next. In the morning, she drove back to Riverside Crest, clocked in, put on her badge, went to Bay 4 to check on the young woman from the accident, who was awake now, confused about where she was, asking for her mother. She's on her way, the overnight nurse told the girl. Evelyn checked the chest tube drainage, proper output, good color, lung reinflating clean on the morning x-ray. She stood at the foot of the bed for a moment. The girl was 19 years old. She was going to be fine. Evelyn initialed the chart and moved on to the next patient. She would not answer the coordinates. Not yet. But she kept the phone in her jacket all day, and she checked it twice more before noon, and the message was still there. Same 3 words, waiting with the patience of something that knew it would eventually be answered. 3 days after that, Dr. Crow called her into his office. She'd half expected this. The incident with the trauma patients had generated paperwork, and paperwork at a place like Riverside Crest eventually landed on Crow's desk, and Crow had the specific type of institutional ego that didn't let things land on his desk without generating a response. His office was on the administrative floor, which was also where the hospital's executive suites were. She'd passed it twice without paying attention. Now she noticed the nameplate, the diplomas in matching frames, the model of a surgical team encased in glass that sat on his credenza like a trophy from a diorama competition. He was standing at his window when she came in. He turned when she closed the door. "Sit down." She sat. He didn't sit. He stayed standing, which was the kind of power positioning that people did when they wanted to remind you of the altitude difference. She let him have it. "I've reviewed the incident report from Friday," he said. "Okay. Your name appears in it 47 times. I was the primary hands-on nurse for most of the documented interventions. You performed a needle decompression and converted it to a chest tube placement on a patient without physician supervision. You directed adjustments to a TBI patient's vasopressor management. You called for a second attending without authorization from the charge nurse. Marisol was occupied. The timeline didn't allow for a chain of command consultation. The timeline is not your call to make." He moved to his desk. Didn't sit. Put his hands on the edge of it. "You are a travel nurse on a 4-week contract. You are not an attending. You are not a trauma surgeon. You are not a physician extender of any kind. Your scope of practice does not include the decisions you made on Friday." She waited. Let him finish. "Dr. Haynes's verbal authorization is documented and legally valid under Colorado Emergency Exception Statute," she said. "I looked it up before I charted." He blinked, just once. "Be that as it may, the clinical staff here has expressed concerns." "Which staff?" "That's not your concern. If I'm being reprimanded based on feedback, I have a right to know the source." "You're not being reprimanded." His voice had shifted, still authoritative, but something behind it had adjusted. "I'm clarifying boundaries. There's a difference." "Understood." She kept her hands relaxed in her lap. "Both patients are alive and making good recoveries. The young woman in Bay 4 is expected to be discharged in 2 days. The male patient is out of immediate danger and is being transferred to a neurology center in Denver. That's the outcome. That's not the point." "I understand it's not the point you want to make." Another blink. This one's slower. He was a smart man. She'd taken note of that, even in orientation, under all the self-congratulatory architecture of how he ran the room. Smart enough to hear what she'd just said and what it meant. She stood. "I'll be more careful about documentation going forward," she said, "and I'll make sure Dr. Haynes's authorization is always on record before I move." She left before he could tell her she was dismissed, which was petty, but she was only human. The call from the unknown number came at 2:14 a.m., 9 days into her posting at Riverside Crest. She was awake. She usually was at that hour. It was a habit she'd never fully broken. The 3 to 4 a.m. window had been, for too many years, the window when things happened. You stayed light in it. She answered on the second ring. The voice on the other end wasn't one of the 4 people who knew the number. It was a voice she hadn't heard in 6 years, and it hit her the way voices from certain specific periods of your life hit you. Not like a sound, but like a physical event. Something that moved through your chest before it registered in your ears. "Senior Chief Cross," the voice said. She said nothing. She was sitting up in the dark motel room, her back against the headboard, completely still. "I know you've been maintaining your cover. I know that's the protocol. But we have a situation, and you're the asset we need." "I left," she said. "I know. I completed my separation. I have paperwork." "I know that too." A pause. "Evelyn, we have one of ours in a very bad place. He's been compromised and he's been holding for 6 days, and his medical status is... The field team says he needs someone with your specific skill set. Not a trauma surgeon, not an ER doc. Someone who can work in the dark with 2 hands and whatever they've got on them and keep a critical patient alive long enough to move him. She closed her eyes. The coordinates I sent, the voice continued. I saw them. There's a team already assembled. You'd be the medical component. We're not asking you to carry a weapon. We're asking you to save a life. You're asking me to come back. We're asking you to come once, for him. She knew who the him was before she asked, but she asked anyway. The name that came back was one she hadn't heard spoken aloud in 3 years. A name that belonged to someone who had once pulled her out of a building in a country she still couldn't legally acknowledge having been in. She lowered the phone, sat with it for a moment. When? She said. The team moves in 4 days. She looked at the window. The dark outside was absolute. No streetlights in this part of the parking lot, just the distant glow of Silver Ridge on the other side of the hill. 4 days. She thought about the girl in Bay 4 who was going to be discharged in 2 days and who would never know who had decided to push the needle exactly where the pressure needed to go. She thought about Crow's office and the 47 mentions of her name in a report. She thought about the duffel bag under the motel bed that she hadn't opened yet. I need a condition, she said. Name it. I come back when it's done. Clean separation. No additional obligations. No reactivation. This is one job. A pause that lasted long enough to mean something. Agreed. She ended the call. Sat in the dark for another 20 minutes. Then she reached under the bed. She pulled out the duffel. Set it on the blanket beside her. Unzipped it slowly. The way you unzipped something you'd been avoiding unzipping because you knew that once you did, a certain chapter that you'd been calling finished was going to open back up. Inside, not weapons. Medical equipment. Field-grade compact, built for conditions where the supply chain didn't exist. Chest seal kits. Hemostatic agents. A surgical kit in a waterproof case that she'd assembled herself over 2 years and modified 6 times. An IV setup designed for single-provider use in the dark. A tourniquet she'd owned for 11 years. She didn't take anything out, just looked at it. Then she heard something. It wasn't a sound from outside. It was more than that. A vibration she felt in the soles of her feet before she heard it. Low, rhythmic, mechanical. The specific frequency of a heavy-duty vehicle moving slowly through a residential area at an hour when heavy-duty vehicles didn't have a civilian reason to move slowly through residential areas. She was at the window before she'd made a conscious decision to be there. 2 black SUVs had pulled into the far end of the motel parking lot. No lights. The engines cut off simultaneously. Nobody got out. Evelyn Cross stood at the edge of the motel window, in the dark, in Silver Ridge, Colorado, and looked at the 2 vehicles that weren't there for a late check-in. Her heart rate was exactly what it always was. Steady, even. 14 months of civilian life, and the body still new. Her phone lit up on the bed behind her. A new message. Same unknown number, same 3-word format. They found you. They found you. Evelyn read the message once, put the phone face down on the bed, and did not move from the window. The 2 SUVs sat in the far end of the parking lot, exactly the way vehicles sat when the people inside them were deciding something. Not surveillance. Surveillance kept moving. These had stopped. That meant they already knew where she was and were now deciding how to approach, which meant they weren't hostile because hostile didn't give you the courtesy of a pause. She exhaled through her nose. Then she picked up her jacket, checked the inside pocket out of pure habit, both phones, motel key, and walked to the door. She opened it before they knocked. There were 2 of them on the walkway, both in civilian clothes that fit the way civilian clothes fit when you were used to wearing something with more structure. A man and a woman. The man was maybe 35, thick through the shoulders, with the particular stillness of someone who'd learned to wait without showing that waiting cost him anything. The woman was older, mid-40s, short hair, a badge lanyard tucked inside her jacket that she made no move to display. Ms. Cross, the woman said. You're not who called me, Evelyn said. No, we're logistics. The person who called you sent us to move you. Move me where? Somewhere that isn't here. There was a compromise on the secondary channel about 4 hours ago. This location was flagged. Evelyn looked at them both for another second. Read what she could read. Then she stepped back from the door. 5 minutes, she said. She didn't give them more than 4. The first duffel, scrubs, paperwork, civilian life, she left on the bed. The second one she zipped and lifted and carried out to the black SUV without any particular expression on her face. And the 2 people who'd come to move her didn't comment on what she was carrying or what she was leaving behind. They drove for 40 minutes, out of Silver Ridge proper, and up into the foothills on the western side to a property that had the look of a hunting lease. A main house, 2 outbuildings, a gravel drive with a gate that required a code. Inside the main house, there were 3 more people, a table covered in maps and equipment, and a coffee maker that someone had recently used. Evelyn poured herself a cup and stood at the edge of the room and assessed. The maps were of a region in western Montana she recognized from the coordinates. Mountainous. Limited road access. 1 primary structure visible in the satellite imagery pinned to the center of the table. The structure had the footprint of a converted agricultural building, the kind of footprint that showed up in remote areas when someone wanted space and solitude and didn't want the architectural profile of something that looked deliberate. Briefings at 0600, the woman said from behind her. Then I'm going to sleep, Evelyn said. Where? She was shown to a back room with a cot and a wool blanket and a window that looked out at the dark hillside. She lay down on the cot without unpacking anything, set her internal clock the way she'd always been able to set it, imprecisely, by maybe 12 minutes in either direction, which was close enough, and closed her eyes. She didn't sleep well, she almost never did. But she rested, which was the practical substitute, and at 5:48 she was up and had found the bathroom and was back at the table with a second cup of coffee when the others started filtering in at 6. The briefing was run by a man she'd never met in person, but whose voice she recognized from the phone call 2 nights ago. He introduced himself as Garrett, which was almost certainly not his name, and he had the manner of someone who'd run enough of these things that the performance of them no longer registered as performance. It was just procedure. He laid out the situation in the compressed specific language that she recognized from a different chapter of her life, the chapter that the 2 duffels represented in their own way. The asset being held was named Marcus Dole, Special Operations. He'd been on an intelligence-adjacent mission that had gone compromised 11 days ago, not 6 as she'd been told on the phone. Someone had been managing the timeline to reduce the apparent urgency, which was either a security protocol or bureaucratic ass covering, and either way it made her jaw tighten. 11 days. Field conditions. Unknown medical status because the last confirmed contact was 8 days ago through a secondary channel that went dark the same night the location was identified. What do we know about his physical condition at last contact? She said. Ambulatory. Communicating. He reported a wound to the right side upper quadrant. He described it as manageable. That was 8 days ago. Yes. An upper right quadrant wound that was manageable 8 days ago could be a lot of things by now. Depending on mechanism and depth, you're looking at possible liver involvement, possible bowel, possible slow bleed that's been accumulating for a week. Or it's a deep graze and he's fine. We don't know. That's why you're here. She put her coffee down, looked at the map. Extraction plan. He walked her through it. It was a reasonable plan in the way that plans made under time and information pressure were reasonable, adequate for the known variables, fragile to anything unexpected, dependent on a 4 to 6 hour window where the opposition's patrol pattern had a gap that the surveillance team had identified over the past 3 days. She asked 7 questions, got useful answers to 5 of them, filed the other 2 as things she'd have to improvise around and moved on. The team moved out at 400 hours. She would tell no one at Riverside Crest where she'd gone. When she returned 31 hours later, she would tell Marisol she'd had a family emergency that had resolved. Marisol would look at her face and not ask a follow-up question, which was the correct response to a face like the one Evelyn was wearing when she came back. She was back in Silver Ridge by the time the highway collapse happened, but not by much. She'd returned at 4 a.m. on a Wednesday, slept 2 hours in the second motel she'd moved to, different property, edge of town, and was at Riverside Crest by 7, badge on, scrubs fresh, face carrying the specific flatness of someone who had not slept enough and was not going to discuss it. Marisol looked at her at the start of the shift and said, "You okay?" "I'm here," Evelyn said. Marisol let it go. That was one of the things Evelyn had come to appreciate about the charge nurse. She had a working knowledge of when pushing would produce information and when it wouldn't, and she didn't waste energy on the second category. The morning was routine. 2 post-surgical patients, a pediatric fever that had been admitted overnight and was trending toward discharge, a man in his 60s with atrial fibrillation that his cardiologist was managing remotely and which required Evelyn's involvement primarily in the form of accurate monitoring and meticulous documentation. At 11:47 a.m., the ceiling shook. It wasn't dramatic. It wasn't a movie moment. It was a low, sustained vibration that moved through the building structure, through the floors, up the walls. And then a sound that arrived after the vibration, a deep tectonic boom of something very large failing very suddenly somewhere close by. The overhead lights flickered. The backup system kicked in. The cardiac monitor on the 60-year-old patient, alarmed briefly, recalibrated, continued. Evelyn was already at the hallway when the radio at the nurse's station erupted. The dispatch voice was controlled in the way that people were controlled when they were reporting something catastrophic, and had decided that the most useful contribution they could make was to stay controlled while they reported it. A section of the Highway 7 elevated interchange, the one that ran over the River Gorge, the main arterial into Silver Ridge from the north, had experienced a structural failure. 3 vehicles had gone into the collapse zone. A semi-hauling construction materials had jackknifed across the adjacent span and blocked the secondary route. Emergency services were being routed through the mountain pass, which added 40 minutes to every response time. The ER attending today was Dr. Priya Bansal, who had been at Riverside Crest for 3 years and was good at what she did and was currently looking at the radio with the expression of someone rapidly recalculating every assumption they'd made about how today was going to go. Crow appeared from the administrative wing. He moved faster than Evelyn had seen him move before, still contained, still projecting the specific authority of someone who believed that authority was its own form of competence, but moving. Bansal, he said. Status. Unknown number of casualties. Inbound time unknown due to route complications. I'm standing up mass casualty protocol now. Do it. I want trauma surgical on standby, and I want the OR team on immediate call. He scanned the floor. His eyes passed over Evelyn the way they usually passed over her. Not dismissively, exactly, but without slowing. Get your travel nurses on basic triage and patient management. Keep the experienced staff for critical bays. Basic triage. Patient management. Evelyn heard it. Marisol heard it too. She caught the charge nurse's expression for a half second before Marisol smoothed it back to neutral and turned to start making calls. Evelyn went to prep supplies. She pulled from the trauma stock methodically, chest seal kits, tourniquet sets, airway management equipment, and staged them in the bays in an order that made operational sense. Most likely needs first, specialty equipment accessible, but not cluttering the primary workspace. She'd done this so many times in so many configurations that her hands moved independently of her thoughts, which freed her thoughts to work on the variables she didn't know yet. Number of casualties, unknown. Mechanism of injury, structural collapse plus vehicle impact, which meant crush injuries, blast pattern trauma from the collapse debris, possible drowning if any vehicles went into the gorge water. Age range, unknown. That section of 7 ran past 3 elementary schools that used the interchange for bus routes in the morning, but it was nearly noon, which changed the demographic profile significantly. She was still thinking through it when the first ambulance arrived. The first wave was 4 patients in 12 minutes. The second wave, 7 minutes after that, brought 3 more. The third wave arrived with 2 ambulances running parallel and a fire department rescue vehicle that had come over the pass and carried 2 patients who had been extracted from a vehicle that went partially over the collapsed section. A minivan, driver, and 1 rear passenger, both alive, both critical. The ER was full in under 30 minutes in the way that mass casualty events filled emergency departments. Not gradually, not in a way that allowed for measured response, but all at once. The ceiling of capacity hit and then exceeded before the systems designed to manage capacity had time to fully engage. Bansal was running the board. She was good at it, allocating resources, calling priorities, keeping her voice even in the specific way that attending physicians learn to keep their voices even because the emotional temperature of the room tracked the emotional temperature of the doctor. And if the doctor sounded scared, everyone got scared and scared. People made worse decisions. She was doing her job correctly. She was also getting behind. Not badly. Not catastrophically. But the board was moving faster than the available hands, and two of the surgical residents had been pulled into the OR for the minivan driver who needed immediate abdominal surgery, and the third-year resident covering the trauma bay was a capable physician who was encountering, for the first time in his training, the specific problem of having more critical decisions to make than he had experienced pattern matching for. Evelyn watched this from Bay 3, where she was managing a 47-year-old woman with a crush injury to her right leg. The injury was significant. Compartment pressures were going to be an issue. Same presentation she'd flagged once before, the same clinical fingerprints. But the woman was stable enough to manage without constant physician oversight if you knew what you were tracking. She knew what she was tracking. In Bay 5, the resident, Dr. Emilio Reyes, was standing over a teenage boy with a head laceration and a deteriorating mental status. And the look on Reyes's face was the look of someone who was running his clinical algorithm and hitting a branch point that his training hadn't fully prepared him for. Evelyn secured her patient's monitoring leads, checked the leg one more time, and walked to Bay 5. "Talk to me," she said to Reyes, not unkindly. He looked at her. GCS dropped from 14 to 11 in the last 6 minutes. Lack is controlled. No obvious skull deformity. Pupils are equal and reactive, but he's getting more confused. Mechanism? He was in the back seat of one of the vehicles near the collapse edge. Car hit debris at speed, airbags deployed. Did he lose consciousness at the scene? Paramedics say brief LOC, less than a minute. She looked at the boy. 15, maybe 16. He was trying to answer a question Reyes had asked him, and getting the words partially wrong, not aphasic, just sliding, the way cognition slid when intracranial pressure climbed. "His pressure's been running high normal since he came in," she said. "Look at the last 3 readings. It's trending, not dramatically, but it's trending, and his respiratory rate just ticked up." She pulled the pulse ox from his finger, checked the waveform. "He's compensating. Early Cushing's response, possibly." Reyes stared at the monitor. If that's right. Get a CT. Now, not in 20 minutes. And get neurosurgery on the phone while it's running. If I'm wrong, you've spent 20 minutes and some contrast. If I'm right, you've got maybe 30 minutes before this becomes a different kind of problem. He moved. Fast and clean, the way residents moved when someone had just organized the information in a way that made the next step obvious. Evelyn went back to her patient in Bay 3. 3 minutes later, Crow materialized at the entrance to the bay. She heard him before she saw him. His shoes on the floor had a particular rhythm, unhurried and deliberate, the walk of a man who moved at exactly the pace he'd decided to move at, regardless of what the room was doing. "Cross." She didn't look up from the leg she was reassessing. "Dr. Crow, you were just in Bay 5. Dr. Reyes needed a second set of eyes on a presentation. I gave him my read, and he made the call." "That's not your position. The board is running 9 critical patients with 2 residents and 1 attending. I have a stable patient in this bay. I used the window." He stepped further into the bay. His voice had dropped below the ambient noise level of the ER, which was still considerable, which meant this conversation was meant to stay between them. "I told Bansal to keep travel staff on basic management." "I heard that." "Then you understand that overriding my instruction, I didn't override anything. I made a clinical observation to a physician who made his own decision. That's within scope." She looked up at him now. "The boy in Bay 5 is going for CT. If it shows what I think it's going to show, he'll need neurosurgery in the next hour. That's the outcome." The ER noise between them was considerable. Alarms, voices, the rolling percussion of equipment being moved. Crow stood in the middle of it with his arms at his sides and the expression of a man who was doing 2 things simultaneously, making an administrative calculation and doing something else, something that he was keeping more carefully contained, which looked to Evelyn like the early stages of genuine reconsideration. He left without finishing the sentence he'd started. By 2 p.m., Riverside Crest had received 14 patients from the collapse. 3 had been taken directly to the OR. 2 were in the ICU. The remaining 9 were distributed across the ER and had been stabilized to varying degrees of confidence. The teenage boy in Bay 5 came back from CT with a subdural hematoma. Small, but expanding. Neurosurgery was in with him inside 40 minutes. He went to the OR at 2:23. Evelyn didn't hear about it directly. She was in Bay 7 with a 62-year-old woman whose blood pressure had been playing games since arrival. Too variable, dropping in patterns that didn't match the documented injuries. When Marisol came to the doorway and said quietly, "Reyes is looking for you. Bay 5 kid is going to the OR." "Good," Evelyn said and turned back to her patient. She found the blood pressure issue 20 minutes later, an undocumented cardiac history that the woman's daughter mentioned in passing while trying to remember the medication list, a detail that reframed the hemodynamic picture entirely. She flagged it, updated the chart, adjusted the monitoring parameters, and called the cardiologist. At 3 p.m., she was standing at the supply room counter writing an incident note when Dr. Bansal came and stood beside her. Bansal was a compact woman with dark hair pulled back and the energy of someone who had been running at high capacity for 3 hours and was managing it, but only just. She didn't say anything immediately. She stood next to Evelyn and looked at the same middle distance for a moment. "The subdural in Bay 5, she said finally. "I saw the preliminary read. If that had gone to CT 20 minutes later," Bansal stopped, started again differently. "Reyes said you caught it." "Reyes caught it. I gave him a differential." "He said you gave him a differential in about 40 seconds. Evelyn put her pen down. "I've seen that presentation before." "Where?" The question was direct and genuine, and Evelyn looked at Bansal's face and saw that the attending wasn't asking to gather ammunition or to challenge. She was asking because she actually wanted to know, in the way that good physicians wanted to know things because understanding the source of useful clinical information was itself useful clinical information. "Environments where imaging wasn't immediately available," Evelyn said. "You learned to catch it earlier." Bansal looked at her for a moment, then nodded once and walked away. It was Crow who came to her at the end of shift, not the administrative confrontation energy of before. He found her in the break room at 6:45, when most of the day shift had already turned over to evenings, and the ER had come down from the mass casualty tempo to something closer to its normal difficult hum. She was sitting with a cup of coffee she hadn't been drinking, staring at the table. He sat down across from her, which was unexpected enough that she actually looked at him. 14 in, he said. 3 surgical, 2 ICU. The rest managed. He paused. Reyes's subdural is out of the OR. Surgeon says the timing was right. Good. It was good work today. She waited. There was more coming. There always was with Crow. He never opened a conversation with the actual point. I've been looking at your employment records, he said. The 2 hospitals before us, Oregon and New Mexico. Your supervisors wrote good evaluations, but both of them said the same thing in different words. That you were difficult to place because you were overqualified for the positions you applied for. Travel nurses take what's available. That's not an answer. It's the answer I have. He put both hands flat on the table. It was a gesture that looked unconscious, the kind of thing people did when they were about to say something they hadn't fully decided to say yet. My surgical record is very good. 11 years as chief, complication rate below the state average. OR efficiency in the top quartile regionally. I know what I'm doing in that building. He tipped his head toward the hallway, toward the hospital beyond it. And I know when I'm looking at someone who also knows what they're doing. Evelyn said nothing. What I don't know, he continued, is what you're doing here. And I don't mean Riverside Crest, I mean Silver Ridge. I mean travel nursing. He held her eyes. I mean this. The break room was quiet around them. The refrigerator hummed. Somewhere down the hall, an IV pump alarmed briefly, and someone silenced it. You assigned me to basic triage this morning, she said. I know. In the middle of a mass casualty event. He didn't look away. I know that too. She picked up her coffee. It was cold. She drank some of it anyway. I'm here because I needed somewhere to be for a while. That's as honest as I can make it. And Silver Ridge is somewhere. She set the cup down. I'm good at my job, Dr. Crow. I always have been. I'm not here to cause problems or take anyone's position or prove anything to anyone. He was quiet for a moment. Then, the woman with the cardiac history in Bay 7, you caught the hemodynamic inconsistency. Her daughter mentioned a medication. You knew what the medication meant before the daughter finished the sentence. I was watching. He paused. That's not community hospital experience. She stood, picked up her cup. I'll be here for the morning shift. She was almost out of the break room when he said, quietly enough that she almost didn't hear it. "I owe you an apology." She stopped, didn't turn around. "You don't owe me anything. The orientation, the assignments, the way I've spoken to you in front of staff. Dr. Crow," she put her hand on the door frame, "save it for the next person you underestimate before they've had a chance to show you what they can do. That's more useful." She walked out. She was 4 steps down the hallway when her phone buzzed. The second phone. She already knew before she pulled it from her pocket that it wasn't going to be anything simple. The message was longer this time, not 3 words. A full paragraph, encrypted header. The format she recognized from active mission communications. The format she hadn't seen directed at her in 14 months. The format that meant someone above Garrett's pay grade was now involved. She read it once in the hallway while a nurse wheeled a patient past her, and the overhead PA called for an attending in the ICU, and the building went on being a hospital around her, indifferent to what was happening in her pocket. Then she read it again. The operation in Montana had produced something unexpected. Not just Marcus Dole, extracted and alive and currently in a military medical facility with a slow hepatic bleed being managed by a surgical team. What the extraction had produced, what had been recovered from the compound's communication systems during the exfiltration, was a data set. 11 years of it. Financial transfers, encrypted correspondence, a mapping of a network that ran from a decommissioned naval commander in the Pacific Northwest to a civilian healthcare executive in... She stopped at the word. Silver Ridge. She looked up. At the hallway. At the hospital around her. At the badge on her chest with the Riverside Crest logo and her name printed in the font they used for all the staff badges and the word nurse beneath it in smaller letters. The message continued. The civilian healthcare executive was identified in the dataset by a code name, but the dataset also contained a physical location, a secondary residence, a post office box, and a work address. The work address was this building, this hospital. The executive had been here the entire time, operating inside the institution, and the intelligence that had been leaking for 11 years. The kind of intelligence that got operators killed in places that couldn't be named had been leaving through this building. Her hands were steady. She was aware of that the way she was sometimes aware of her own physiological responses, not as a comfort, but as information. At the end of the hallway, the elevator doors opened, and Dr. Crow stepped out with the hospital's executive director, Philip Sterrett, both of them in conversation, both of them walking toward the administrative wing, and Sterrett was laughing at something Crow had said, head tilted back, completely at ease. Evelyn watched him. Philip Sterrett, executive director. 11 years at Riverside Crest. 11 years. She put the phone back in her pocket and stood in the middle of the hallway while the hospital moved around her, and she thought about the data set and the code name in it, and the length of time the leak had been running, and the operators who'd been compromised during that span, and the one she'd just pulled out of a Montana compound after 8 days of captivity with a wound that had been manageable, and then, by the time she got to him, was not. Sterrett's laugh reached her from down the hallway, warm and easy, the laugh of a man who felt entirely safe. She watched him until he turned the corner and was gone. Then she took out the phone again and typed 4 words back to the sender. "I'm already inside." The response came back in 11 minutes. 11 minutes was fast. Fast meant people on the other end had been waiting for exactly this kind of update, which meant the situation was further along than the message had implied, which meant Evelyn was already behind the information curve by the time she thought she was catching up to it. She went to the staff bathroom at the end of the trauma wing, locked the door, and read the full follow-up transmission. The dataset recovered from the Montana compound had been partially decrypted in the 31 hours since extraction. The civilian code name in the files, designated Harrow in the operational documents, corresponded to a financial signature that federal investigators had been tracking for 6 years without a source identity. Harrow had been routing payments through a series of medical supply contracts, the kind of contracts that a hospital executive would have legitimate authority to sign, legitimate reason to manage, and legitimate cover to obscure. The contracts were real. The supplies were real. The payments that went sideways inside those contracts were not. 11 years. 7 confirmed operator deaths that could be traced, with the recovered data, to compromised mission parameters. 3 more probable. Marcus Dole had been number 11. She put the phone in her pocket and looked at her reflection in the bathroom mirror for a moment. Not for any particular reason. just to have something steady to look at while she organized what came next. What came next was that she needed to go back out onto that floor and finish her shift and not give Philip Sterrett, or anyone near Philip Sterrett, any indication that the ground under his feet had just changed permanently. She ran the water, dried her hands, went back out. Sterrett was gone from the hallway by the time she returned, which was fine. She didn't need to see him again tonight. She needed to observe without being observed, which was a different thing, and which required that she look exactly like what she appeared to be. A travel nurse finishing a long shift after a mass casualty event, tired, unremarkable, already thinking about the parking lot and the drive back to the motel. She spent the last 90 minutes of her shift doing exactly that. Finishing charts, checking her 2 remaining patients, giving a thorough handoff to the evening nurse, a quiet man named Dennis, who took notes and asked good questions. She said goodnight to Marisol, who was still at the station, still running on what Evelyn estimated was hour 13 of what had been scheduled as a 10-hour shift. Go home, Evelyn told her. 20 minutes, Marisol said, which meant 40. Evelyn drove back to the motel, sat in the truck in the parking lot for 3 minutes, then went inside and called the number that Garrett had given her. Not the one that had sent the transmissions, but a direct line, a voice line, the kind of communication that left a different kind of record and was therefore used when the situation required clarity over caution. He picked up on the second ring. I know who Harrow is, she said. A pause. Not surprised that Garrett didn't do surprise, or if he did, he'd learned to keep it somewhere it couldn't be heard. Tell me, she told him. Name, title, institution, 11 years, the supply contracts. While she talked, she heard typing on his end, quiet and continuous, the sound of information being routed upward through a chain she couldn't fully see. When she finished, he said, Can you confirm direct access to the subject? He walks the floor I work on. Yes. We need 48 hours to build the federal component. Arrests without that documentation are dismissible. He needs to go down clean. I understand that. In the meantime, cross. His voice shifted slightly. Not softer, more careful. He doesn't know what was recovered. As of now, he has no reason to believe the compound material is compromised, but if something tips him, nothing will tip him from my end. There's another variable. He paused. The naval commander on the other side of this, Admiral retired Victor Hess, Pacific Northwest, that's confirmed now. He's been dark since the Montana operation. We think he knows the compound was hit. We don't think he knows yet what was recovered, but he's not static. If he moves, then your 48 hours gets shorter. Yes. She looked at the ceiling of the motel room. Water stain in the corner, shaped like a badly drawn state of Ohio. Then I'd suggest your people move faster. She ended the call. Lay back on the bed without taking her shoes off and stared at the Ohio-shaped stain and thought about Victor Hess going dark and what dark meant for a man who'd spent 30 years learning how to make problems disappear before they became problems. She was back at Riverside Crest at 7 the next morning. The shift was quiet by the previous day's standards, 2 overnight traumas, both managed by the night team, both stable. The mass casualty paperwork from the highway collapse was generating administrative work that had pulled Crow into his office for most of the morning, which meant the floor ran on Bansal and Marisol and the residents, which in Evelyn's experience meant it ran better. She watched Sterrett twice that morning without watching him. The first time was at 8:40, when he came through the ER on what appeared to be an administrative walkthrough, the kind of thing executives did periodically to demonstrate investment in clinical operations. He moved through the space with the ease of someone who knew it well, nodding at staff, pausing at the nurse's station to ask Marisol something about supply delivery timelines. His affect was pleasant, completely normal. The affect of a man who had woken up that morning with no reason to believe anything had changed. Evelyn was on the other side of the bay, documenting, and she did not look up from her screen. The second time was at 11:15 when she passed him in the hallway outside the administrative wing. He was coming out of a conference room with 2 people she recognized as department heads, mid-conversation, carrying a portfolio under his arm. He glanced at her the way administrators glanced at floor staff, a registering look, not an engaging one, and continued past without slowing. She continued past without slowing either. In the break room at noon, she ate half a sandwich and drank coffee and thought about the supply contracts and the 11 years and tried to construct the logic of it from the inside. An executive in an institution like this had access to a specific kind of information, not operational military detail, not classified mission parameters. What he had access to was personnel movement, medical logistics, the administrative scaffolding around deployments. The kind of background data that looked like nothing individually and became a targeting map in aggregate. You didn't need to know the mission to compromise the operator. You needed to know that a specific person with a specific medical record and a specific set of institutional affiliations was moving through a specific region at a specific time. That was enough. That had apparently been enough, 11 times to be enough. She finished the sandwich, threw away the wrapper, went back to work. The call from Garrett came at 2:57 p.m., routed through the encrypted line to the second phone, which meant it was significant enough that he wasn't willing to leave it in text. Hess moved, he said. She stepped into the stairwell, let the door close behind her. Where? Boarded a private charter out of a regional airport in Oregon at 0600 this morning. Flight plan filed for New Mexico, which we believe is false. The charter landed at a private strip 40 minutes north of Silver Ridge at 0947. She processed that. Hess had been in the air before she arrived at the hospital. He'd landed while she was watching Starrett do his walkthrough. He's here. He's somewhere in the Silver Ridge area. We don't have eyes on him yet. Ground team is 20 minutes out. Your 48 hours just became 0. I know. Cross. He stopped. The pause had a specific quality to it. The quality of someone about to say something they'd been authorized to say and weren't entirely comfortable saying. There's authorization to move on Harrow today. Federal team can be on site in 90 minutes, but we need you inside when it happens. Starrett will attempt to destroy the local documentation the moment he knows we're coming. There are files in his administrative system that corroborate the financial chain, and he has the access and the motive to wipe them. We need someone physically present in the administrative wing before the arrest team arrives. You need me to keep him in place and away from his system. Without alerting him, yes. She looked at the stairwell wall, concrete block painted beige, a fire extinguisher mounted in a red bracket. I'm a nurse. You're also the only person in that building we trust. What's my play? Fabricate a reason to pull him into a clinical situation, something that requires his attention in a non-administrative space, via 60 to 90 minutes. A clinical situation. In a hospital, that was not a difficult thing to fabricate the pretext for. Emergencies happened. Executives got pulled into them. It was the nature of the environment. But a fabricated emergency had consequences. Other staff would respond. Resources would be allocated. She wasn't going to manufacture a patient crisis. I'll find another approach, she said. I'll find another approach. 90 minutes. She put the phone away, stood in the stairwell for 30 seconds, then pushed through the door and walked toward the administrative wing. The approach she found was simple because the best approaches usually were. Starrett's assistant, a young man named Ben who had the organized efficiency of someone who'd found his professional niche and was content in it, sat at a desk outside the executive suite. Evelyn had spoken to him twice before, briefly, during administrative errands. He knew her face and her badge, and not much else. She went to his desk. I need 10 minutes with Mr. Starrett, she said. It's about the mass casualty supply depletion from yesterday. Dr. Crow asked me to bring it directly to administration before end of day. Ben checked his screen. He's got a call at 3:30. I'll be quick. He knocked on the inner door, relayed the message, and waved her in. Starrett's office was a corner room with windows on two sides and a view of the mountain range to the west, that on a clear day was probably excellent, and today was partially obscured by cloud. He was standing at his desk when she came in, the portfolio from this morning open in front of him, a pen in his hand. Ms. He checked the badge. Cross. Supply depletion from the MCI? Yes. I wanted to flag it before the evening reorder went in. We burned through our chest seal inventory significantly, and the secondary hemostatic stock is below the recommended threshold. Given the highway situation isn't fully resolved, the interchange was still partially closed. This was accurate. Marisol thought it was worth escalating. He nodded, set the pen down. Reasonable. Send me the specific numbers, and I'll approve an emergency reorder this afternoon. I have them here. She produced a folded sheet of paper, the inventory printout she'd pulled from the supply room 20 minutes ago, which was a real document containing real numbers. She held it out. He took it, read it. The natural next step was that he would walk to his computer to initiate the reorder, which was what she needed him away from. Pull up a chair. I'll get this started now. I appreciate it. She sat, not in the chair directly across from his desk. That was the supplicant position, the one that put his screen at her back. She took the chair to the side, the one that visitors used when they were reviewing documents together, the one that gave her a sight line to his monitor. He moved to his computer, logged in with the ease of long habit, the kind of ease that meant he didn't register what he was doing as a security behavior, just as a motion. She noted the sequence without appearing to note anything. He pulled up the supply ordering system and began entering the numbers from her sheet. She asked 3 questions about the ordering process that she already knew the answers to, which kept him talking and kept his attention on the screen in front of him and off the broader context of a trauma nurse sitting in his office at 3 in the afternoon asking about supply chain logistics. At 3:18, his desk phone rang. He glanced at the display. Something shifted in his face. Not dramatically, not in any way that would mean anything to someone who wasn't watching carefully. A tightening around the eyes. A fractional pause before he reached for the handset. "Excuse me a moment." He picked up. "Stare it." She watched his face. Whatever came through the phone, it took 4 seconds to register, and then it registered completely. The color in his face changed. His hand on the desk moved to the edge of it, fingertips pressing down. His eyes went to the computer screen in front of him. Not to her, not to the room, to the screen, and then moved away from it, which was the eye movement of someone who'd just thought about doing something and decided they couldn't do it with a witness present. "I'll call you back," he said into the phone. Set it down. He was very still for a moment. Then he turned to look at her, and for the first time in 2 interactions, he was actually seeing her. Not badge checking her, not categorizing her as floor staff, seeing her. Something in his expression had reorganized itself, and the reorganization made him look older and much less pleasant. "I think we're done here," he said. "The reorder? Send the numbers to Ben. He'll handle it." He was already standing, already moving toward the door, the specific movement of someone who needed to make a phone call in private immediately. "Thank you for bringing it up." She stood, moved toward the door at a pace slightly slower than his. "Of course. Should I let Dr. Crow know you'll process it today?" "Yes, fine." He was at the "Mr. Starrett?" She stopped. Let him look back at her. "Is everything okay?" The pause lasted 2 seconds. In those 2 seconds, she saw the calculation, who she was, what she knew, whether her presence was coincidence or something else. He reached the conclusion that she was a nurse who'd been in his office about inventory and was now asking a polite social question. "Everything's fine," he said, and opened the door. She walked out, down the hallway, past Ben's desk, around the corner and out of sight line from the executive suite. Then she pulled out the phone and typed, "He just got tipped. Moving now. You have less than 30. The response came in 40 seconds. "Team is 12 minutes out. Hold position." She looked at the hallway. 12 minutes. Starrett was in his office making a phone call and deciding how fast he could move. His computer, the one with the corroborating financial files, was sitting logged in on his desk, because she'd been there when he logged in, and she'd been there when he stood up and he hadn't logged out, because logging out in front of her would have been a tell. The administrative wing had 1 elevator and 1 staircase. The elevator was at the far end. The staircase was 10 feet from the executive suite door. She walked back down the hallway, past Ben's desk. Ben looked up. "I forgot the inventory sheet," she said. He buzzed her through. She opened the inner door. Starrett was on his cell phone, back to the room, facing the window with the mountain view. At the sound of the door, his shoulders went rigid. He turned. The computer screen was still lit, still logged in the supply ordering system, but the supply ordering system sat inside the same administrative login that accessed everything else. "I told you we were done," he said. The pleasantness was entirely gone. What was underneath it was controlled and cold in the way of someone who was used to managing situations and was currently managing this one. "I know." She stood in the doorway, didn't move further in, just stood there. "I just wanted to be here when they arrived." He stared at her. The phone call he'd been on, She could hear the tinny sound of a voice still talking through the handset. Went silent. "Who are you?" he said. Not a question. The inflection of someone revising a file they thought was complete and finding pages they hadn't known existed. "I'm a travel nurse," she said, "currently assigned to your trauma floor." "Who sent you?" "The supply numbers I brought you are real. We do need to reorder." He moved. Not toward the door, toward the desk, toward the computer, with the speed of someone who had decided that the most critical thing in the next 30 seconds was the keyboard. She'd anticipated this. She was already moving to the other side of the desk, not blocking him physically. She had no authority to block him physically, but placing herself between him and the machine in the way that made the geometry of reaching it complicated. "Mr. Starrett," her voice was level. "The federal team is 8 minutes away. The files you're thinking about have already been flagged for preservation by a court order that was issued 40 minutes ago. Deleting them now adds destruction of evidence to what's already there." He stopped, looked at her. The calculation was happening again, faster this time, and arriving at a different answer. The file revision was complete. The new version had her in a different category entirely. Not floor staff, not coincidence, not a nurse who'd wandered into an administrative meeting about inventory. "You've been here for weeks," he said slowly. "Yes." "The travel nurse, the one from the highway collapse." "Yes." Something moved across his face that she'd seen before on other faces, in other contexts. The specific expression of a person understanding that they've been outmaneuvered by someone they never considered a threat. It was a particular kind of humiliation, different from ordinary defeat, because it contained within it the retrospective awareness of every moment they'd felt superior. He sat down. It wasn't surrender, it was the movement of a man making a calculation about what the next 60 minutes could still produce if he stayed calm. "I want a lawyer," he said. "That's your right," she said. "But you should know that Victor Hess landed 40 minutes north of here this morning, and your federal situation is going to look very different depending on whether you're the person who cooperated or the person who waited for Hess to determine your value." The name. She watched it land. His face did something complicated. Then it did something simpler, which was the thing faces did when the variables had finally produced a number that couldn't be argued with. From down the hall, she heard the elevator open. Multiple sets of footsteps. Not hospital footsteps. A different weight, a different rhythm, the particular cadence of people who moved with purpose and didn't slow down for institutional courtesy. Starrett heard it too. He looked at the door, then at her, then at the computer screen, which was still lit, still logged in, still containing 11 years of supply contracts and financial routing inside an administrative login that a federal forensic team would spend the next week taking apart with the careful patience of people who had court orders and time and no reason to hurry. "The man you helped put in that compound in Montana," Evelyn said quietly. "He has a daughter. She's 8. He's been missing for 11 days. She paused. "She got her father back yesterday." Starrett looked at his hands on the desk. The footsteps in the hallway stopped outside the door. 3 sharp knocks. Then, "Federal agents, Mr. Starrett, please step away from the desk." Evelyn moved to the side of the room, clear of the door, and watched Philip Starrett, executive director, 11 years, supply contracts and dead operators, and a code name that had taken 6 years to trace, stand up from his chair and put his hands where they asked him to put them. She was still standing there when the second agent came through the door and looked at her badge and said, "Ma'am, I'm going to need you to step out." She stepped out. In the hallway, Ben was on his feet behind his desk, face white, watching federal agents come through the administrative wing like weather. 2 more were already at the filing room. 1 was stationed at the elevator. She walked past all of it, toward the stairwell, toward the clinical floors where her patients were and her charts were, and the work she'd actually come here to do was waiting. She pushed through the stairwell door and found Victor Hess on the other side of it. He was alone. That was the first wrong thing. A man of his background, in a situation this compromised, arriving at a hospital where his network was in the process of collapsing, he should not have been alone. He was in his late 60s, heavy-set, in civilian clothes that were slightly wrong for the weather, and he was holding a phone in his hand and looking at her with the expression of someone who had come here expecting to find Starrett, and had instead found something he didn't have a name for yet. For 2 seconds, neither of them moved. Then Hess said very quietly, "Phoenix." She heard the name the way she'd heard it the night the SUVs pulled into the motel parking lot. Not as a surprise, as a confirmation. "Admiral," she said. Her voice was completely even. "You should put the phone down." He looked at it. At her. At the door behind her, through which the sounds of federal agents in the administrative wing were now clearly audible. "It's over," she said. His face did several things in rapid succession that she didn't have time to fully catalog, because his hand moved, not to put the phone down, but to his jacket, to something inside his jacket, and she was already moving before the thought had fully completed, already closing the distance between them in the narrow stairwell with the concrete walls and the red fire extinguisher in the bracket on the wall above the first landing rail. His hand came out of his jacket with a compact semi-automatic that he'd had the presence of mind to bring and the poor tactical judgment to reach for in a closed stairwell with a person already inside arm's reach. She took it from him in 4 seconds. It wasn't elegant. Her left forearm hit something on the rail that was going to bruise deeply, and she felt it immediately. The specific burning impact of bone on metal, but the weapon was in her hand and Hess was against the wall, and the door above them burst open as 2 federal agents came through it responding to the noise. "Contact," she said, loud, clear, the way you said things when you needed them heard and acted on immediately. "Suspect is unarmed. I have the weapon. It's safe." She held the gun by the barrel away from her body and looked at the 2 agents coming down the stairs toward her. Hess slid down the wall and sat on the landing with his hands up, breathing hard, and the sound he made was not angry and not defiant. It was the sound of a man arriving at the end of something that had been running for 11 years and finding that the end was a stairwell and a travel nurse and federal agents coming through a door. One of the agents took the weapon from her. The other had Hess in cuffs before he'd finished catching his breath. The first agent looked at her badge, at her hands, which were steady, at the bruise already developing on her forearm where it had hit the rail. "Are you injured?" "I'm fine," she said. "Ma'am, I need you to come with me. I have patients on the 4th floor." He looked at her for a moment with an expression that suggested he'd dealt with a lot of situations in his career and was uncertain which category this one belonged to. "I'll need a statement." "I know. Get Hess secured first. I'll be on the 4th floor when you need me." She reached past him and pushed the stairwell door open. "It's the next exit up." She walked through the door and back onto the clinical floor, past the nurse's station where Dennis was starting to pick up on the fact that something significant was happening 2 floors up, past Bay 3 where her patient with the crush injury was healing steadily, past Bay 5 where the teenager had been and was now in surgical recovery and doing well. She stopped at the nurse's station, picked up a chart, began reading. Her hands were still steady. Her forearm, underneath her scrub sleeve, was beginning to swell in a way that was going to make the next few hours uncomfortable. She'd need to ice it and probably get it imaged before shift end to rule out a fracture, which was going to generate paperwork and questions she was not particularly looking forward to answering. Down the hall, her work phone buzzed with a message from Marisol. "What is happening in admin right now? There are suits everywhere." She was typing a response, something non-committal about administrative matters, when a different notification appeared on the second phone. Not Garrett, a number she'd never seen before, with a format she recognized. Official military channel. Flag-level communication. She opened it. The message was 3 sentences, and by the time she finished the 3rd sentence, she understood that the 48 hours Garrett had asked for, and the 90 minutes she'd bought, and the 11 years that had been running inside this building were no longer the most significant thing happening. Because the dataset from Montana had contained one more layer that no one had told her about, a layer that had just been decrypted in the past hour. And what it showed was that Harrow had not been working alone inside Riverside Crest Medical Center. There was a second name, and it was someone she saw every single day. She read the message a second time, not because she'd misread it the first time, because the brain did that sometimes. Ran the information twice when the information was significant enough to warrant confirmation that the first pass had been accurate. It had been accurate. The second name in the dataset was encoded differently from Starrett's. Not a code name, but a personnel identifier, the kind of internal tracking number that military and federal contractors used when they wanted a reference that was meaningful within a system and opaque outside it. The decryption team had matched it to a civilian record in the past hour. The civilian record attached to a medical license. The medical license attached to a name that Evelyn knew, Dr. Nathan Crow. She stood at the nurse's station with the chart in one hand and the phone in the other, and the fourth floor of Riverside Crest moving around her in its ordinary afternoon patterns. And she thought about 11 years and supply contracts and a chief of surgery who had been running this department for exactly that long and who had access to something Starrett hadn't had directly: patient records, staff movements, the clinical documentation that showed which personnel with which histories had passed through this hospital at which times. Starrett had handled the financial layer, the routing, the payments, the contract structures that moved money in ways that looked legitimate. Crow had handled the intelligence layer, the human data, the names. Together they had built something that had worked for over a decade because it was distributed across two people who had plausible, independent, institutional reasons for accessing everything they accessed. She put the phone in her pocket. Crow was in his office. She'd seen him go in 40 minutes ago and hadn't seen him come out. The administrative wing was now active with federal agents, which meant the sound of that activity had been audible on the floors below. It wasn't a quiet operation, federal arrests in a hospital executive suite, and Crow was either unaware or was sitting in his office processing what that sound meant. She needed to know which one. She gave herself 4 seconds to stand at the nurse's station and be a nurse reviewing a chart. Then she put the chart down, told Dennis she'd be back in 10, and walked toward the elevator. The door to Crow's office was closed. His assistant, a woman named Patricia, who had been with him for 7 years and ran his schedule with the quiet authority of someone who knew where everything was at all times, looked up when Evelyn came down the administrative corridor. This corridor was 1 floor below and 1 wing removed from where the federal team was working, which meant the activity there hadn't physically reached here yet. But the sound had. The building carried sound in certain directions when conditions were right, and the sound of multiple people moving quickly through the floor above them, the brief exchanges and the particular clipped register of people executing a task under authority, had clearly reached Patricia's desk. She was sitting very straight. Her computer was on, but she wasn't looking at it. "Is Dr. Crow available?" Evelyn asked. Patricia looked at her with the expression of someone trying to determine what category of situation they were in. He said he wasn't to be disturbed. It's clinical, quickly resolved." She kept her voice at the register she used for administrative interactions. Mild, professional, unremarkable. 30 seconds. Patricia picked up the phone, knocked at the same time, which was the move of someone who'd been told not to disturb him and was looking for cover from both directions. She announced Evelyn. A pause. Then she set the phone down and nodded. Evelyn opened the door. Crow was at his desk, but not working at it. I was sitting in his chair turned slightly to the side, facing the window that looked toward the parking structure, and he had the look of a man who had been sitting exactly like that for some time, not doing anything, just sitting, which for a man like Crow, who was constitutionally opposed to stillness, was its own data point. He turned when she came in. She read his face in the time it took to close the door behind her, which wasn't long, but was long enough. He knew something was happening. He didn't know yet exactly what it was, which meant the federal team hadn't reached him, which meant she had a window. She crossed the room and sat in the chair across from his desk without being invited. He watched her do it. "There are federal agents in the executive suite," she said. "Philip Starrett is in custody." He was very still. "I heard activity." "I thought you should hear it directly." A pause. She was watching everything. His hands, which were on the armrests of his chair with the specific quality of hands that had been placed there rather than resting there. His eyes, which were processing. The slight shift in his breathing that was the only external tell on a man who'd spent decades learning to present a controlled surface. "Why are you telling me this?" he said. "Because you're the chief of surgery, because it affects this institution, and because I wanted to see how you reacted when you heard it." The room went very quiet. He looked at her for a long moment with those assessing eyes. The same ones he'd turned on her in orientation, the same ones she'd watched recalibrate across 4 weeks as she'd consistently failed to be what he'd initially decided she was. "That's not why travel nurses come to the chief's office," he said. "No. Who are you?" She'd been asked that twice today. By Starrett, in a way that was really asking, "What are you? What function? What threat? What category of problem?" By Hess in the stairwell, as recognition. From Crow it landed differently. More genuine. Less strategic. The question of someone who had been carrying a version of a person in his head for 4 weeks, and was now understanding that the version was wrong. "I'm going to ask you something," she said, "and I need you to think carefully before you answer, because the answer matters. Not to me, to what happens in the next hour." He said nothing, which was, for Crow, a form of assent. "The personnel identifier in the dataset recovered from the Montana operation," she said. "Contractor code NRC 7741. Do you know what that is?" The stillness that came over him was different from the stillness before. The before stillness had been controlled, managed, the posture of a man choosing how to engage. This stillness was the kind that came from the outside, imposed by information arriving that reorganized the room. "Where did you hear that?" he said. His voice was flat in a way it hadn't been before. "Federal investigators matched it to your civilian contractor file, the one that dates to a consulting arrangement with a naval logistics firm 11 years ago, a firm that Hess was affiliated with." He stood up. It wasn't aggressive. He stood the way people stood when they needed to move because staying seated had become physically untenable. He went to the window, put one hand on the frame, and looked out at the parking structure. "Crow." He didn't turn. "If you ran when you knew I was coming to find you," she said, "it would answer a question the investigators are currently treating as open. Right now it's open. It doesn't have to close the way you're thinking it's going to close." A long silence. Outside his window, in the parking structure, she could see one of the federal vehicles, the dark SUV that had been staged in the east lot since before she'd gone to Sterrett's office. "I didn't know what it was," he said. "Not at first." She waited. The firm sent consultation requests, medical record pattern analysis. They framed it as outcomes research for veteran healthcare policy. "I was building my career. They paid well and the request seemed legitimate." He stopped. "By the time I understood what the data was being used for, I was already—" He stopped again. "Already in," she said. "Already in." He turned from the window. His face had changed in the way faces changed when the structure they'd been maintaining came down. Not collapsed, but visibly unsupported. He looked his age, and then a little older than that. "I never had names. I want you to understand that. I never knew who was being targeted. I provided aggregate data, clinical profiles, movement patterns from medical records, nothing that I thought could— 7 operators are confirmed dead, 3 more probable." She said it evenly, not cruelly, but without the softening he might have wanted. The aggregate data was the targeting mechanism. The names came from the aggregates. He sat back down, not in the deliberate way he usually moved, but like the decision to be upright had become too much to maintain. She sat across from him and let the silence work. Not as a tactic, as a fact. The silence was what the situation actually was, and dressing it in language wasn't going to change its dimensions. "What happens now?" he said. "Federal agents will come to this office, probably in the next 20 to 40 minutes. What happens in that conversation is substantially determined by what you've done before they arrive." He looked at his computer. She knew the same thought Sterrett had had, the instinct toward deletion that was human and understandable and would have made everything worse. "Don't," she said. He looked at her. "Whatever's in that system that connects to NRC 7741, leave it there. Document destruction at this point adds a charge and removes the only leverage you have, which is the capacity to be useful to investigators working the Hess side of this. Hess is the primary target. You're the institutional layer. That's a meaningful difference if you let it be one. You're advising me. I'm telling you what I know about how this works." He stared at the desk. His hand moved slightly toward the keyboard and then moved away. "Why would you—" He stopped, started differently. "I've been making your professional life difficult for 4 weeks. You have. I assumed you were— I know what you assumed." He was quiet. Then, "I owe you an apology." She'd heard those words from him before, last night, in the break room, in the tentative and partial way that men who weren't practiced at apology began the motion of it. This time it came differently. Not tentative, stripped of the architecture that usually surrounded his speech. "Treat the next person better," she said. "That's more useful than the apology." She stood. He looked up at her from the chair, and he looked for the first time like a person rather than a position. Diminished and human and sitting with the weight of a specific kind of reckoning that would take years to fully work through. She didn't feel satisfaction about it. She didn't feel much of anything about it except a tired clarity, the kind that came at the end of long operations when the objectives had been met and the cost was visible. "When they come," she said, "tell them everything, specifically the Hess connection. That's the thing they most need and the thing that most helps you." She left the office, told Patricia on the way out that Dr. Crow would be available shortly and to hold his calls. The federal team reached Crow's office at 4:47 p.m. Evelyn was on the fourth floor when it happened, aware of it through the secondary phone. A brief notification from Garrett, second subject in custody, cooperative. She was standing at Bay 4, reviewing the discharge paperwork for a post-surgical patient who was going home tomorrow, and she noted the message and put the phone away and kept working. The fourth floor didn't know what was happening 2 floors below it. Marisol's messages had continued, a stream of increasingly specific questions as the afternoon progressed and the administrative disruption became impossible to ignore. And Evelyn had answered them in the minimal way that was honest without being informative. Federal matter. Administrative, not clinical. Marisol had the intelligence to read between those particular lines and the professionalism not to push further while the floor had patients to manage. At 5:30, the federal agent who told her to come with him in the stairwell, she'd learned his name was Special Agent Dario Voss, came to the fourth floor and found her at the nurses' station. "Statement," he said, not unkindly, but with the efficiency of someone who had been running at high operational tempo for several hours and was still not done. "I know." She logged her current note, told Dennis she'd be back, and walked with Voss to a small conference room that had been commandeered for federal use. 2 other agents were there, a recorder, a form on the table. She gave her statement in the precise, sequential way she'd been trained to give reports, chronologically, specifically, without editorializing. The stairwell encounter with Hess, the weapon, the sequence of actions, her forearm, which she'd had imaged on a break, and which had produced a hairline fracture of the ulna that was going to require a brace for 3 weeks, and was currently producing a specific aching throb that she was managing by not moving it unnecessarily. "You need that looked at," Voss said, glancing at the forearm. "I've had it looked at. I have a brace to pick up from the orthopedic clinic tomorrow." "You disclosed the injury at the time of the encounter?" "I disclosed that I was uninjured at the time of the encounter. I was managing the situation. The injury was not affecting my function." A beat. "It still isn't." He wrote something on the form. She couldn't tell what. "Miss Cross, I need to ask you directly. Your role here today. You were contacted by federal personnel prior to the arrests. You facilitated access to the subject. You physically intervened with an armed individual in a stairwell." He looked up. "Your employment record says you're a travel nurse." "It does." "That's not what today looked like." "I'm a travel nurse who had a previous career with different skill sets. The previous career ended. The nursing career is real. Both things are true simultaneously." He held her gaze for a moment, then wrote something else. "We'll need your contact information for follow-up. You have it through the channel that reached me initially." He nodded once, closed the folder. "You're free to go back to your floor." She stood. At the door she stopped. "Hess. Secured. Being transported to a federal facility tonight." "And Sterrett." "Same." She nodded and went back to her floor. By 7 o'clock, Riverside Crest was running on institutional confusion and rumor. The federal presence had been significant enough and visible enough that the staff had stopped pretending they weren't aware of it. The ER was operating normally because emergencies didn't pause for administrative crises, but the administrative wing was closed, and Crow's absence from the floor had been noted, and the hospital board's legal representative had arrived at 6:15 and was in a conference room with people Evelyn didn't recognize. She stayed on shift until 7:30, finishing her documentation, completing her patient handoffs, and doing the ordinary work of a nurse at the end of a 12-hour day. Her forearm ached steadily. She'd taken ibuprofen at 5 and would take more when she got back to the motel. At 7:20, Marisol found her in the charting room. The charge nurse came in and closed the door and sat down across from her and looked at her with the particular directness of a woman who had decided she'd been patient long enough. "Tell me what I actually need to know," Marisol said. "Not the version for the administrators. The version for the person who runs this floor." Evelyn looked at her. She thought about what Marisol actually needed. Not the full operational picture, not the classified layers, but the clinical and institutional information that would let her do her job in the days ahead. Sterrett and Crow are both in federal custody, she said. The nature of the charges is federal, and I can't speak to specifics. The hospital will have an interim leadership structure in place by tomorrow. Your floor is not implicated in anything. The issue was entirely at the executive and administrative level. And you? I'm a travel nurse on a 4-week contract. Evelyn. Marisol's voice had dropped the professional register entirely. I've been running trauma floors for 12 years. I know what different kinds of nurses look like. I knew from your first week that you were something else. I didn't push because... She paused. Because you were doing good work, and the patients were benefiting, and that seemed like the part that mattered. But I need to know if you're going to be here tomorrow. The question was practical and personal simultaneously. Whether Evelyn was operationally committed to the floor, but also whether Marisol's read of her as someone worth trusting had been correct. I'm going to be here tomorrow, Evelyn said. As long as the contract runs, I'm here. Marisol looked at her for a moment longer. Then she stood up. Your forearm, she said. Get the brace tonight, not tomorrow. I will. And eat something. You didn't have dinner. She left. Evelyn sat in the charting room for a moment longer, listening to the floor, the monitors, the call buttons, the specific acoustic texture of a hospital at the beginning of night shift, and thought about the data set and the second name and the hairline fracture and the 8-year-old girl in a naval family somewhere who had her father back. Then she finished her chart, logged out, and went to get her jacket. The parking lot at 7:45 was the particular post-shift quiet that large institutions generated, the changeover done, the day staff gone, the night staff inside, the lot between full and empty. Her truck was where she'd left it that morning, which felt like a long time ago and also somehow like the same continuous moment. She was unlocking it when her personal phone rang. Not the second phone. The regular one, the number she gave to actual people in her life, which at this point was a short list. The number on the screen was one she recognized. Her contact at the veteran advocacy organization she'd been connected to through a transitional program 2 years ago. A woman named Sylvia Oakes, who ran the medical liaison branch and who Evelyn had spoken to maybe 4 times total, always briefly, always in the context of administrative transitions between postings. Sylvia didn't call at 7:45 on a workday without a reason. She answered. Evelyn. Sylvia's voice had the particular quality it had when she was managing something she didn't want to manage. I'm sorry to call you outside business hours. It's fine. What is it? I got a call this afternoon from someone at the Department of the Navy, a Vice Admiral, Miriam Solis. A pause. She's been trying to reach you through official channels, but your file has been in a restricted status for, she said, 14 months. Evelyn stood next to her truck in the parking lot and looked at the mountains to the west, which were going dark against a sky that was still carrying some light in the upper registers. She left a contact number, Sylvia said. She asked me to give it to you directly. She said, another pause, and Evelyn could hear Sylvia reading from a note. She said to tell you that your service record has been reviewed at the flag level and that there are matters that need to be addressed in person. And she said, a brief hesitation. She said to tell you that the team knows what you did today. Evelyn closed her eyes for a second. 14 months of separation. 14 months of community hospitals and motels and travel contracts, and the careful practice of being someone whose name appeared in no systems that anyone significant was looking at. 14 months of the second duffel bag under the bed and the second phone in the jacket pocket, maintained out of habit, used twice. Thank you, Sylvia, she said. Is everything okay? Yes, everything's fine. She ended the call. Stood in the parking lot. The mountains were fully dark now against the last of the sky's light. She thought about calling the number Sylvia had given her. She would, not tonight, but tomorrow or the day after. She wasn't ready for whatever that conversation was going to contain. She had a fracture to brace and a floor to run and discharge paperwork in the morning and a patient in Bay 4 who needed one more assessment before the attending signed the discharge order. She got in the truck. She was reaching to start it when her headlights, which she hadn't turned on yet, reflected off something in the rearview mirror. Another vehicle, parked 2 rows behind her, engine off. Dark sedan. No plates visible at this angle. She sat very still. The sedan didn't move. Its windows were tinted past what the civilian standard allowed, which was either a wealthy civilian cutting a regulatory corner or something else. She ran the probability quickly. Hess was in federal custody. Sterrett was in federal custody. The federal team itself had no reason to watch her parking lot exit. The local threat profile had changed substantially in the past 4 hours. Substantially. Not completely. Because Hess had come alone, which she'd identified as the first wrong thing, which meant either his network was more degraded than anyone had estimated, or he'd come alone because the person he was meeting didn't need to see him arrive with support. Sterrett had received a phone call. She'd watched it land on his face. The call had come from someone who knew the compound had been hit. Hess's network had a domestic layer. The dataset had shown Sterrett and the financial routing. It had shown Crow and the clinical data. But 11 years of an operation this size didn't run on 2 people in one regional hospital. Networks had redundancy. Networks had fail-safes. And the dataset, the message had said, had been partially decrypted. She watched the sedan in her rearview mirror for 45 seconds without starting the truck. Then the sedan's engine turned on. No headlights. It pulled forward 1 row and stopped. Her phone buzzed. The second phone. The message was from Garrett, and it was not the kind of message that Garrett sent unless the situation had changed in a way that required immediate acknowledgement. Third identifier confirmed. Local law enforcement, Silver Ridge PD. Do not engage. Do not go back to the motel. Team is 12 minutes out. Stay in a populated area. She looked at the sedan, which had moved 1 row closer and stopped again, and understood that the person inside it had been watching the hospital all day, and had seen the federal vehicles, and had watched Voss walk in and out, and had been sitting in this parking lot calculating what the events of the afternoon meant for their own exposure, and had decided that the travel nurse who'd been at the center of all of it was the most immediate variable to resolve. She started the truck, pulled forward, away from her normal exit, toward the hospital's main entrance where the lights were brightest and the security desk was staffed, and there were cameras covering every angle of the drive. The sedan's headlights came on behind her. She kept her speed exactly at the lot's posted limit, both hands on the wheel. Left forearm registering the pressure of gripping through the bone bruise in a way that was genuinely unpleasant, and that she filed away as something to manage rather than something to stop for. 12 minutes. She'd needed 30 seconds in a stairwell. She'd needed 90 minutes in an executive suite. She'd needed 4 weeks on a hospital floor to find something that had been hidden for 11 years. 12 minutes, in a well-lit parking lot with security cameras, was a manageable interval. She pulled up to the main entrance circle and put the truck in park, and left the engine running and sat under the lights while the sedan stopped at the edge of the circle, 60 feet back, and whatever was about to happen arranged itself around the simple fact that she was still here, still upright, and had absolutely no intention of being moved. The sedan sat at the edge of the entrance circle with its headlights on and its engine running, and Evelyn sat in her truck under the lights with her engine running, and for 40 seconds neither of them moved. She used the 40 seconds. The hospital's main entrance was covered by 4 cameras she could identify from this position, 2 mounted above the automatic doors, 1 on the corner of the building facing the drive circle, 1 on the parking structure entrance to her left. Security desk was staffed by a man named Roy, who worked evenings and who she'd exchanged brief hellos with over 4 weeks of late departures. Inside the lobby, visible through the glass, 2 visitors were waiting near the elevator and a custodial staff member was running a floor polisher along the far wall. Populated, lit, documented. The sedan hadn't moved because moving meant committing, and whoever was in it was still calculating whether the calculus had changed enough to justify whatever they'd come here to do. She was betting it hadn't. She was betting that a Silver Ridge PD connection meant someone who understood cameras and witnesses and evidence chains, someone who'd been running a careful operation for years and hadn't survived this long by being reckless. The gamble was that careful people didn't do reckless things under pressure. The gamble was also that 12 minutes was 12 minutes, and it was currently minute 3. Her phone buzzed. Garrett, 8 minutes. Can you confirm your position? She typed back one-handed. Main entrance circle. Vehicle stationary 60 feet behind me. Populated. Cameras. His response? Stay there. Do not exit the vehicle. She wasn't planning to exit the vehicle. At minute 5, the sedan's reverse lights came on. It backed up slowly, turned in the lot, and moved toward the secondary exit. Not the main drive, the service road exit that ran along the east side of the building. She tracked it in her mirror until it cleared her sight line. She typed, "Vehicle moving, east service exit." "Garrett, we see it." "Ground team redirecting. Stay put." She stayed put. At minute 9, 2 vehicles came through the main hospital entrance at a speed that was several increments above the posted limit, but not so dramatic as to constitute an emergency approach. Dark SUVs. They didn't stop at her truck. They went straight through the circle and around the east side of the building, following the service road. At minute 11, her phone rang. "Garrett, voice call." "We have him," he said. "Vehicle stopped at the service road gate. Driver is a Sergeant Dale Pruitt, Silver Ridge PD, 12-year veteran. He's being detained." She let out a breath that she hadn't been fully aware she was holding. "Is he talking?" "Not yet. He will." A pause. "Cross, you need to come in tomorrow morning. Federal Field Office in Denver. There are people who need to speak with you in person." "I have a shift." "Your shift will be covered. Marisol is already short. Evelyn." He used her name, which he almost never did. "It's that kind of meeting. Be there." She looked through the windshield at the hospital entrance, at the lobby lights, at Roy behind the security desk, who had no idea what had just happened in his parking lot. "What time?" she said. 9 a.m. I'll send the address." She ended the call, sat in the idling truck for another minute. Then she drove back to the motel, the second one, the one she'd moved to after the original location was flagged. And she ate a gas station sandwich and took more ibuprofen and lay on the bed with the brace she'd picked up from the orthopedic clinic's after-hours window, staring at the ceiling. She didn't sleep much, but she rested. And by 4 a.m., she'd stopped replaying the parking lot and started thinking about what 9 a.m. in Denver actually meant. And what it meant was that 14 months of careful, deliberate smallness was over, and something else was beginning, and she wasn't entirely sure what to do with that. The Federal Field Office in Denver was a building that looked like every federal building in every mid-sized American city, functional, slightly underlit, with the specific impersonal gravity of a place where significant things happened to people who hadn't expected them. She arrived at 8:52, checked in with her driver's license and her nursing badge because she didn't have anything else, and was walked to a conference room on the 4th floor by an agent who made small talk about the weather and didn't ask her any questions. The conference room had a long table and 6 chairs and a window that looked out at a building that looked back at it. 3 people were already there. She knew one of them from a photograph. Vice Admiral Miriam Solis was in her late 50s, in full-dress uniform, with the bearing of someone who had spent decades being the most prepared person in every room she entered and had stopped finding that remarkable. She stood when Evelyn came in. That was the first thing. She stood. The other 2 were a man in a civilian suit who introduced himself as a federal prosecutor named James Okafor, and a woman in military legal uniform who said her name was Commander Petra Walsh and did not elaborate. Evelyn sat down. Solis sat across from her and looked at her for a moment in the direct assessing way of someone who had read a file thoroughly and was now comparing it to the person. "Senior Chief Cross," she said. Evelyn said nothing. She waited. "I've read the operational reports from the past 72 hours, and I've read your file. All of it. Not the sanitized version that's been in the restricted system for 14 months. The full record." She paused. "I want to begin by saying that the manner in which your separation was handled was not appropriate, and that the record restriction that followed it caused harm that this office is responsible for, and that we are here today in part to address that." Evelyn had not been expecting that sentence. She'd been expecting a debrief, a legal review, an operational postmortem. The directness of the accountability landed differently than she was prepared for. "All right," she said. Her voice came out steady, which was good. Okafor opened a folder. "The investigation into Harrow, now identified as Philip Sterrett, and the associated network has been formally connected to 7 confirmed operator deaths and 3 additional probable fatalities over the 11-year operational period. The evidence recovered from the Montana compound, combined with the cooperation of Dr. Nathan Crow and the financial documentation preserved from Starrett's administrative system, constitutes a prosecution package that our office is confident will result in convictions." "What charges?" she said. "Sterrett. Conspiracy to commit espionage, wire fraud, obstruction, and 7 counts of accessory to the deaths of federal officers." Crow. Conspiracy, unlawful disclosure of protected health information in a national security context, and accessory charges that are still being calibrated against the level of his cooperation. Okafor looked up. He has been cooperative, extensively. And Hess? Admiral retired Victor Hess faces the primary espionage charges. He's not cooperating. He doesn't need to. The data set is sufficient. A beat. Sergeant Pruitt of the Silver Ridge PD is facing obstruction and conspiracy charges. He was a peripheral contact, Starrett's eyes in the local area, but was not aware of the full scope of the operation. He pointed a sedan at me in a parking lot. He followed you. He didn't act. His attorney is arguing that distinction aggressively. Okafor's tone suggested what he thought of that argument. It won't change the charges materially. Solis leaned forward slightly. I want to talk about your record. Commander Walsh slid a document across the table. Evelyn looked at it without picking it up. It was a formal military record, her military record, and the classification markers at the top were different from what she knew they'd been 14 months ago. The restriction stamps were gone. In their place was a different designation. Your service record has been reviewed at the flag level, Solis said. The separation that was processed 14 months ago was initiated under a classified administrative action that we now believe was itself compromised, initiated by a contact within the Naval Logistics Network that has since been identified as part of the Hess operation. In short, you were separated, in part, because someone in that network wanted your specific skill set out of the institutional structure where it could identify them. The room was very quiet. Evelyn picked up the document. Read the first page, then the second. Your record has been restored to its full operational status, Solis continued. Your decorations, your service citations, your commendations, all reinstated. The classified operations in which you participated are still classified, but your participation in them is documented correctly. A pause. We owe you that, at minimum. Evelyn set the document down. She was aware of a pressure behind her sternum that was not pain. It was something else. The specific physical sensation of something that had been held at tension for a long time being released, the body registering relief before the mind had caught up to it. At minimum, she repeated. Yes. Solis held her eyes. There's more. The more took 40 minutes to lay out, and it came from Walsh rather than Solis. The legal and institutional components, the formal offers, the specific language of what the Navy was prepared to do and what it was asking in return. Evelyn listened without interrupting. She asked 4 questions, all of them specific, all of them answered directly. When Walsh finished, Solis took it back. We're not asking you to return to active duty, she said. Your separation stands, and it stands because you chose it, and that choice was legitimate even if the mechanism that produced it wasn't. What we're asking is different, she paused. The gap that this operation exposed isn't primarily in intelligence or in special operations. It's in the civilian medical institutional space, hospitals, healthcare networks, the places where personnel data lives, where movement patterns are documented, where a determined operator with institutional access can build a targeting picture over years. We don't have people who know both sides of that wall. You want a consultant. We want a senior chief who spent 14 months actually working inside a civilian trauma center and can help us design a protection framework that reflects what that environment actually looks like from the inside. A beat. You don't have to carry anything. You don't have to go anywhere you don't want to go. You design it, you train for it, you help us understand what we're protecting against, and you do it from wherever you are, including Silver Ridge, if that's where you want to be. Evelyn looked at the document on the table. Her name at the top of it, her record restored, her decorations listed in the formal language of institutional recognition. She thought about Marcus Dole's daughter, who was 8 and who had her father back. She thought about the teenager in Bay 5 whose subdural hematoma had been caught in time. She thought about the woman in Bay 4, 19 years old, who'd pulled her first full breath after the needle went in. She thought about Marisol on hour 13 of a 10-hour shift, asking what she actually needed to know so she could run her floor. I need to finish my contract at Riverside Crest, she said. Solis looked at her without surprise. Of course. And I need it to be genuinely flexible. If I'm on a floor, I'm on a floor. I'm not half present. Understood. And I want the families of the 7 to have access to the full record of what happened, not the classified operational details. The accountability. They deserve to know that the people responsible for the compromises that killed their family members are facing prosecution. Solis was quiet for a moment. That's not entirely within my authority to promise unilaterally. Then make it within your authority. Evelyn held her gaze. They've been waiting 11 years for an explanation. The least we can give them is the truth of what the explanation is. Another pause. Then Solis nodded. I'll make it happen. Evelyn picked up the document, read the last page, signed where Walsh indicated. She drove back to Silver Ridge in time for the afternoon shift. The hospital was different when she walked in, and also exactly the same. The administrative wing was still operating under an interim structure. The board had appointed a temporary executive director from the regional health system, a woman named Dr. Adrienne Pack, who had arrived Monday morning with an operations team and the specific competent energy of someone brought in to stabilize a situation rather than transform it. The executive suite that had been Sterrett's was now an evidence room, sealed with federal tape that would come down when the forensic documentation was complete. Crow's position was under review. He was not on the premises. He would not be on the premises for some time, and possibly not ever again. That was a determination that would come out of the legal process, the hospital board review, and the state medical licensing authority, all of which were now simultaneously engaged. His patients had been redistributed among the surgical staff. The floor ran on, because floors ran on. That was the nature of them. Marisol was at the nurse's station when Evelyn came in. She looked at the brace on Evelyn's forearm, looked at Evelyn's face, said nothing for a moment. "You're late," she said finally. "I know. I'll make up the time." "You'll do no such thing. You've been here every day this week, including the MCI day." Marisol turned back to her board. Bay 2 needs a line check, and the patient in room 9 has been difficult about her medication schedule. Start there. Evelyn started there. The shift was ordinary in the way that shifts after extraordinary events were ordinary. The work didn't pause. The patients didn't know or care what had happened in the administrative floors. The monitors alarmed and the charts accumulated and the hours moved at exactly the pace hours moved. She drew the line in Bay 2 on the first attempt, which was harder with the brace on her left arm than without it, but not impossible. She spent 20 minutes with the woman in room 9, who was not difficult about her medication schedule, so much as frightened about her diagnosis, and using the medication schedule as the available proxy for that fear. And once Evelyn had sat with her long enough to find that out, the schedule ceased to be an issue. At 4:30, Dr. Bansal found her in the hallway. The attending looked like she'd slept slightly better than she had during the MCI week, but not dramatically so. She fell into step beside Evelyn. "Interim director wants to meet with department heads tomorrow," she said. "She's also asking for input from clinical staff on the emergency protocol review." A pause. "I suggested your name." Evelyn glanced at her. "For the protocol review? You ran 2 simultaneous critical traumas and then ran the MCI floor better than anyone with twice your official authority." "Yes, for the protocol review." Bansal's voice was dry in the particular way of someone who had thought about how to phrase something and landed on dry as the most accurate register. "Unless you have objections." "I don't have objections." "Good." Bansal peeled off toward Bay 6. 4 o'clock tomorrow. Bring your notes from the MCI. Evelyn had notes from the MCI. She had notes from everything. 3 weeks later, on a Thursday morning that had turned out clear and cold with the Rockies visible from the hospital parking lot, in the particular sharp way they were visible when the air had no moisture in it, Evelyn was finishing a chart at the nurse's station when she heard the elevator. Not the sound of the elevator opening, the sound of what came out of it when it opened. Footsteps. Multiple. The specific rhythm and weight she'd catalogued before. She finished the line she was writing in the chart. Vice Admiral Miriam Solis came around the corner first, out of uniform this time. Civilian clothes, practical. The kind of clothes someone wore when they didn't want the uniform to be the first thing the room responded to. Behind her was Garrett, whose name she'd learned was actually Garrett, which she'd found faintly disappointing. Behind him was a man she didn't recognize and a woman carrying a document case. And behind all of them, walking with a cane and a gait that was still compensating for a healing hepatic wound, was Marcus Dole. She stood up from the chair. He looked like he'd aged 5 years and lost 20 pounds, which was accurate. 11 days in a compound and a month of surgical recovery would do that to a person. He was tall, dark-skinned, with close-cropped gray at his temples that she was fairly sure had not been there before the compound. He walked carefully. He was smiling. "Senior Chief," he said. "You're not supposed to be traveling," she said. "I'm not supposed to do a lot of things." He stopped in front of her. "I heard you have a hairline fracture." "Healing." "I heard you took a gun away from a retired admiral in a stairwell." He made it easier than he should have. He looked at her for a moment with the specific expression of someone who has thought about a person from a distance for a long time and is now reconciling the thought with the reality. "You pulled me out of there," he said, "and then you came back here and went back to work." "The work needed doing." "Evelyn." He said her name like a decision. "Thank you." She looked at him, at the cane, at the gray temples, at the fact that he was standing in a hospital corridor in Colorado instead of the alternative, and felt the particular weight of it, not as pride or relief, but as something quieter than either of those things. The weight of a thing mattering. "How's your daughter?" she said. His face changed completely. "She made me a card. It has a drawing of me on it that looks like a potato with a hat." He paused. "It's the best thing I've ever been given." She laughed. It came out slightly unexpected, real in the way things were real when they weren't performed. "Good." Solis stepped forward. The document case opened. What followed took 35 minutes and happened in a conference room that Marisol had cleared with the particular efficiency of a charge nurse who had been briefed and was choosing not to ask any follow-up questions yet. The staff found out in the way hospital staffs found out, by noticing that the charge nurse had cleared a conference room and that there were people in civilian and dress clothes on a Thursday morning, and by the time the meeting concluded and the door opened, a significant portion of the fourth floor was finding reasons to be near the nurses' station. The formal restoration of Evelyn's service record had been processed in Denver. What Solis carried with her to Silver Ridge was the documentation of what came with the restoration, the commendations, the citations, 4 decorations that had been sitting in a locked administrative record for 14 months, and a formal letter from the Department of the Navy that used specific public language about her service and its value and the error that had produced her separation. There was also a formal letter from the federal prosecutor's office in Denver documenting her cooperation in an active federal investigation and the specific actions she'd taken that had contributed to the arrest of 3 individuals facing federal charges. Solis handed her both. Evelyn read them at the conference table, aware of the weight of the moment and not entirely sure what to do with it, which was fine, which was human. "There's one more thing," Solis said. She nodded to the woman with the document case. "The families of the 7 operators who were killed as a result of compromised intelligence in the Hess-Starrett network have been notified of the prosecution. Each family has received a formal communication from the Department of the Navy acknowledging the source of the compromise and the accountability measures currently in progress." She paused. "That was your condition?" "Yes." "It was met." Evelyn looked at the table for a moment, then looked up. "All 7. All 7. Outside the conference room, she could hear the floor, monitors, movement, the ordinary ongoing sound of a place where people came when they were at their worst and needed something they couldn't provide for themselves. The sound was the same as it had been on her first day, and her second, and every day since. Unaffected by federal arrests or military delegations or restored service records. Just the persistent, demanding, clarifying work of it. Bottom. When the door opened, Marisol was the first person she saw. The charge nurse was standing at the nurses' station with the expression of someone who has been told a great deal and is processing its relationship to everything she already knew. Behind her, Dennis and 2 of the other day shift nurses were finding elaborate reasons to be exactly where they were. Dr. Bansal was coming out of Bay 3 and had stopped in the doorway. Solis came out behind Evelyn. She looked at the assembled staff with the awareness of a flag officer who understood rooms and what rooms needed. She addressed them directly, which was its own thing. Not a statement to the air, but actual eye contact with actual people. "This facility performed extraordinarily under difficult circumstances," she said. "The clinical staff of this floor, specifically, acted with the kind of integrity that doesn't get acknowledged often enough in environments like this. That matters. I wanted to say it directly." She paused. "Ms. Cross is a considerable asset to this hospital. Whatever you thought you knew about her, she's more than that." Marisol looked at Evelyn. "I knew that," she said. Not to Solis. to Evelyn. Evelyn looked at her. "I know you did." Marcus Dole, who had been leaning against the conference room wall with his cane and what was apparently a permanent mild smile, said, "She set my IV in the dark in a moving vehicle on a mountain road." "He's exaggerating," Evelyn said. "I'm not even slightly exaggerating." Bansal looked at Evelyn with the expression she used when she was arriving at a clinical conclusion. "The protocol review," she said. "I'm going to need more than one session." "I know. And PAC wants you in the Emergency Preparedness Working Group." "I know that too." Solis moved to stand beside Evelyn, not in front of her, beside her. That distinction was deliberate, and Evelyn registered it. "One last thing," she said, quietly enough that it was for Evelyn rather than the room. She reached into the document case herself this time, took out something small. A coin. A challenge coin, Navy, with a specific design that Evelyn recognized from a particular operational unit. She placed it in Evelyn's hand. "Senior Chief Evelyn Cross," she said. "Welcome home." The words landed in the specific way that particular words landed when they were the right words at the right time. Not like a ceremony, but like a door opening into a room you'd been standing outside of for longer than you'd realized. Evelyn closed her fingers around the coin. She didn't cry. She wasn't the kind of person who cried easily, and the moment was too full for a single response anyway, containing as it did too many things simultaneously. The 14 months and the 7 operators and the stairwell and Marcus Dole's daughter's potato drawing and the teenager in Bay 5 and the girl in Bay 4 pulling her first real breath. She stood with all of it and held the coin and looked at Marisol, who was looking back at her with the expression of a woman who had run 12 years of trauma floors and knew the difference between someone who was passing through and someone who had arrived. Garrett shook her hand. Solis shook her hand. Dole hugged her, awkwardly, because of the cane, and she helped him keep his balance, because old habits, and he laughed about it. They left at noon, the way they'd come. Elevator, footsteps, gone. The floor filled back in around her. Dennis went back to his charts. Bansal went back to Bay 3. Marisol went back to the board, because the board didn't care about federal visitors or restored service records. The board had patients on it, and patients needed nurses. Evelyn put the coin in her jacket pocket, next to the second phone, and went back to work. She thought about it later. Not that night, because that night she slept better than she had in a long time, the specific sleep of someone whose body had finally received permission to rest. But in the days that followed, when the adrenaline had metabolized and the legal proceedings were underway, and Riverside Crest was settling into its new interim structure, and the work was just the work again. She thought about what it meant that the thing which had almost destroyed her, the separation, the isolation, the deliberate reduction of her to a travel nurse in a series of small hospitals, had also been the thing that put her in the right place at the right time to see what nobody else had seen. She'd been underestimated, deliberately, methodically, by people who thought that making someone invisible was the same as making them harmless. It wasn't. It had never been. And she'd known that somewhere, in the specific quiet way she knew things she didn't always put into language, that the diminishment was not the truth of her, that the scrubs and the travel contracts and the motel rooms were not the sum of what she was capable of. She'd kept working, she'd kept being precise and careful and present in each place she landed, because that was the thing she knew how to do, and because the work was real even when the circumstances around it were not. People underestimate the quiet ones. They always have. There's a particular arrogance in the assumption that loudness equals capability, that rank equals competence, that the person who doesn't announce themselves doesn't have anything worth announcing. Crow had built a career on that assumption. Starrett had built a conspiracy inside it. Hess had hidden a network beneath it. And Evelyn Cross had walked into all of it with a duffel bag and a travel nursing badge and the specific, unglamorous, absolutely irreducible skill of knowing what she was doing. That was the thing, not the decorations, though they were hers and she'd earned them and she wasn't going to pretend otherwise. Not the coin in her pocket or the restored record or the federal letters. Those were acknowledgement. Acknowledgement mattered, but it was not the source. The source was the 14 months of not stopping, of continuing to be exactly what she was, in exactly the circumstances she'd been handed, without the institutional validation that told her she was allowed to keep going. Of walking into Riverside Crest Medical Center with cracked mirrors on her truck and keeping her hand steady on a patient who was dying, because that was what the moment required, and she was the person in the moment who could do it. She thought, too, about the families who were finally getting their answers. 7 families. 7 people who had left for missions that went wrong in ways that weren't their fault and weren't random, but were targeted, and the people who'd loved them had been carrying that incompleteness for years. The knowledge that someone was accountable, that the accountability was public, named, and moving through a legal process that would produce consequences, was not the same as getting back what they'd lost. She knew that. Everyone knew that. But it was something. It was the truth, which was what people deserved and were so rarely given. She owed them more than she could give. That was just the fact of it, and she sat with the fact without trying to resolve it into something cleaner. On a Friday afternoon, 6 weeks into her posting, she was at the nurses' station when Dr. Pack, the interim director, stopped beside her. "The Emergency Preparedness Working Group meets Monday," Pack said. "I understand you have direct experience in mass casualty situations that goes beyond standard nursing scope." "I have some relevant experience, yes." "Good." Pack looked at the board, at the floor, at the institutional machinery of it. "I want to revise our trauma protocols before the level 1 application goes in. Marisol says you flagged 3 gaps during the MCI response." "4, actually." Pack looked at her. "Write them up. Bring them Monday." She wrote them up. She had her notes. She always had her notes. The following Monday, she sat in a conference room with Pack and Bansal and the trauma medical director and 2 emergency management coordinators. And she talked about what a trauma floor actually looked like from the inside when it hit capacity, and what the protocol gaps were, and what the fixes were, and what the fixes cost in terms of training time and supply positioning and staffing structure. She talked for 40 minutes. She answered questions for 30 more. Nobody in the room looked at her badge and decided in advance that her answer wasn't worth the attention. It was not a dramatic moment. It was a meeting. But it was the kind of meeting where the right information got into the right hands, and those hands belonged to people who would use it. And the people it would eventually reach were patients who hadn't arrived yet, people who would come through the Riverside Crest Trauma Bay in some future emergency and survive it because the protocols had been built correctly by someone who understood both the civilian and the operational sides of what surviving looked like. That was the work. Unglamorous, specific, continuing. She drove home. To the new apartment she'd signed a lease on 2 weeks ago, the first lease she'd signed in 14 months. A second-floor unit on the east side of Silver Ridge with a window that faced the mountains and a parking spot that fit the truck. And she made dinner, which was eggs and toast because she was tired and eggs and toast was enough. And she sat at the table and looked at the challenge coin she'd set beside her water glass. Then she picked up her phone and called the number that Sylvia had given her. "This is Solis," the Vice Admiral said. "It's Cross." A pause. "I've been thinking about the consultant framework." "And?" "I want to design the training component myself, not review someone else's curriculum, build it from the foundation." A brief silence. "That's a larger commitment than we initially—" "I know what it is." Evelyn looked at the coin. "The gap isn't in the intelligence side. It's in the medical institutional culture. The people who run those facilities don't know what they don't know about how data becomes a targeting mechanism. You can't protect against a threat you don't understand. I understand it." Another pause. "Let me build the thing that actually addresses it." Solis was quiet for long enough that Evelyn listened to the silence and found it thoughtful rather than resistant. "Send me a framework outline," Solis said finally, "within the week. You'll have it in 3 days." She ended the call, ate her eggs, washed her plate. Through the east window, the mountains were dark against a sky that still held the last edge of color. That particular hour when day hadn't fully committed to becoming night, when the shapes of things were clearest because the light was going and the eyes had to work harder to hold them. She stood at the window for a minute. She was a travel nurse with a hairline fracture and a truck that needed an oil change and a lease signed in a town she'd arrived in with no plan to stay. She was a senior chief with a restored record and a coin in her pocket and 7 families who were finally getting answers. She was a woman who had been made small, deliberately and systematically, by people who had mistaken her silence for emptiness and her stillness for weakness, and who had found out, at considerable institutional cost to themselves, that they were wrong. She was all of those things at once, none of them canceling out the others. The thing about being underestimated is that it tells you nothing about yourself and everything about the person doing the estimating. She'd learned that not as a maxim, but as a lived experience, in motel rooms and stairwells and break rooms and trauma bays. In every moment she'd kept working while someone with a title looked through her like she wasn't there. She'd kept going not because she was certain it would matter, but because stopping had never been the kind of option she could choose. That was the quiet strength they never understood. Not the tactical skills, not the medical training, not the classified record. Those were tools. The strength was the refusal to become what dismissal wanted to make her: smaller, uncertain, apologetic for taking up space. She had never apologized for that. She wasn't going to start. The last light left the sky. She turned away from the window and sat down at the table with her laptop and opened a new document and began to write the framework outline that would become, over the next 18 months, the foundation of a protection program that nobody had built before because nobody had lived on both sides of the wall. The cursor blinked. She wrote the first line. Outside, Silver Ridge settled into its evening, and somewhere on the east side of town, the lights of Riverside Crest Medical Center held their position on the hill, visible for most of the valley, constant and necessary, doing what it had always done, waiting for whoever needed it next, ready to receive them, lit up against the dark.